from 5, and then we'll start. 5, 4, 3, 2, 1. The Committee on Education and Labor will come to order. Good morning, everyone. I note that a quorum is present. The committee is meeting today to hear testimony on examining policies and priorities of the U.S. Department of Health and Human Services. Pursuant to Committee Rule 8C, opening statements are limited to the chair and ranking member, and I recognize myself for the purpose of making an opening statement. Today, we are meeting to discuss the Department of Health and Human Services budget request for fiscal year 2023. Secretary Basara, I'm pleased to welcome you back to the committee, which we once both served on together, to hear your vision to ensure that our well-being of our country is taken care of. We know the Biden-Harris administration needs a robust COVID package to address both the immediate and long-term consequences of the pandemic. It is my hope that we can send the president that legislation in just a few days. We must also address our nation's mental health crisis. I was encouraged to see the recent budget proposal strengthens coverage and expands access to behavioral health care. And I finally look forward to working with you in the department to ensure that we address systemic inequities in health care. The pandemic laid bare longstanding biases and barriers to health care. And to recite Dr. Martin Luther King's observance about inequities, he once said that of all forms of inequality, injustice in health care is the most shocking and inhuman. This is a reminder that health care is also a civil rights issue. So thank you for your time, and I now recognize the distinguished ranking member, the gentlelady from North Carolina, Dr. Fox, for her opening statement.
Thank you, Mr. Chairman. It's so nice to get started promptly this morning. Secretary Basara, President Biden's HHS budget for fiscal year 2023 is full of misplaced priorities and reckless spending. If this budget passes, $127.3 billion in discretionary spending would be allocated to HHS, meaning taxpayers would be forced to give your agency an additional $13 billion. This staggering price tag doesn't even include your request for $22 billion for so-called COVID-19 funding. States are awash with federal dollars, and your administration has still not provided Congress with adequate accounting of where past COVID-19 dollars have gone. HHS has delivered nothing but mixed messages over the past year, from masking and vaccinations to school reopenings and the risk COVID poses to children. Nobody knows where the so-called guidance begins and the contradictions end. Your agency is leading the charge to expand the Affordable Care Act and Medicaid, dismantling employer-sponsored health insurance in the process, expand access to abortions and force taxpayers to fund them, impose socialist drug pricing controls, encourage minors to receive permanent gender reassignment surgery and hormone treatments, and stop the faith community from maintaining its identity while continuing to participate in programs to help those in need. This insanity makes it clear that HHS is more interested in serving a splinter group who identify as the progressive left than the American people. Today, our colleagues across the aisle will sing your praises and act as if HHS is doing an excellent job. They'll also conveniently gloss over the fact that HHS has demonstrated over and over again that its true North Star is a radical progressive ideology devoid of reason and common sense. Mr. Secretary, HHS is a federal agency funded by hardworking taxpayers, not a social science experiment. You would do well to remember that. Thank you, Mr. Chairman. I yield back.
Thank you. I'll now introduce our witness just very briefly. The Honorable Javier Basara is the 25th Secretary of the Department of Health and Human Services and the first Latino to hold the office in the history of the United States. Previously, he served 12 terms in Congress, including service on this committee, and as Attorney General of the state of California. We appreciate the Secretary for participating today and look forward to your testimony. Your written statement will appear in full at the hearing record, and you're asked to limit any oral presentation to a 5-minute summary. After your presentation, we'll move to member questions. The witness is aware of his responsibility to provide accurate information, so we'll therefore proceed directly with your testimony. So welcome, Secretary Basara.
Mr. Chairman, Ranking Member Fox, and members, thank you for having me. It's great to be back. As I recall, I think my chair was somewhere way down there when I served on this committee, and it's good to be back. I will try to keep with the chairman's admonition and keep my remarks as short as possible, and hopefully you'll back some time. Today, more than 255 million Americans have received at least one dose of a COVID-19 vaccine. 2/3 of adults over age 65 have gotten their booster shots. And we've also been able to close the gap in vaccine rates we usually see for communities often left behind. It has paid dividends to surge resources, including tests and treatments, to our hardest hit and highest risk communities. 325 million free COVID-19 at-home tests have been shipped. 270 million free N95 masks. From the $186 billion appropriated by Congress for the Provider Relief Fund, 766,000 payments to over 400,000 providers who have received payments for COVID services. That's real money, real relief, real results. Beyond COVID-19, today more Americans have insurance for their health care than ever before. That includes a record-breaking 14.5 million Americans who secured health insurance through the Affordable Care Act. That's a big deal. Less noticed, we launched Operation Allies Welcome, an HHS-led effort that has helped over 68,000 of our Afghan brothers and sisters who are refugees settle in America. And we're coordinating nearly $300 million in nationwide support for the launch of the 988 National Suicide Prevention Lifeline this July. HHS has also made key investments to close holes in our public health system in areas like maternal health, where we've extended Medicaid coverage for postpartum care for a new mother and her baby from 2 months to 12 months. The President's 2023 budget lets us build on that record of investment in America's health. It proposes $127 billion in discretionary budget authority and $1.7 trillion in mandatory funding, including a historic investment to transform the mental health infrastructure in our country, a priority I know for many of you. It also asks for $82 billion for the President's pandemic preparedness proposal to get ready for whatever might come next after COVID-19. Considering that COVID has cost this country more than $4.5 trillion in direct support from the federal government so far, this investment of $82 billion is a no-brainer to prepare for the next pandemic. The funding we're requesting will be end-to-end, which means it's going to be for research, development, approvals, deployment, and effective response. Mr. Chairman and members of the committee, this budget turns hardship into hope and inclusion into opportunity, and I look forward to working with you to make it a reality to continue our efforts to give the American people real relief, real results, and real peace of mind. And I'd be happy to answer any questions you might have.
Thank you very much. Under Committee Rule 9A, we'll now question witnesses under the 5-minute rule. And again, I ask members to be very strict with the 5 minutes and not begin questions with just a few seconds left. We'll be recognizing committee members in order of seniority, beginning with the gentleman from Connecticut, Mr. Courtney.
Thank you, Mr. Chairman, and good morning, Mr. Secretary. Those were eye-watering statistics in terms of the pandemic response, and which I think is going to go down in the annals of our country's public health history. So congratulations on the great work your department has done. I wanted to focus for a second on another initiative that you have taken on, which is last January when the Medicare Part B premiums were rolled out, it jumped from $148 a month to $170 a month. And again, as you correctly pointed out at the time, a large part of that was driven by the need to adjust quickly to the FDA approval of Aduhelm, which was, again, a new Alzheimer's drug. The calculation from CMS was based on the drug manufacturer's price, which was $56,000 per patient per year That subsequently, because of public pressure, was cut from $56,000 per patient per year to $26,000 per patient per year. But by then, the Part B premiums were already in play and were, again, taking a chunk of people's Social Security checks. Again, you immediately, I think, called on the department to take a second look at this. I led a letter with 31 members supporting your efforts. We're in April right now. Can you give us an update in terms of whether or not there's going to be, hopefully, some common sense adjustment based on the price change?
Congressman, first, good to see you. And secondly, thank you for the work you've done to try to protect seniors under Medicare. ADUHELM is probably something we're going to start seeing more and more often because of technology and the science driving medicines sometimes to our tables faster than before. This is the first time we've actually seen a drug come forward that FDA has approved, at least conditionally, for Alzheimer's. And so you know there's a hunger out there in America for this drug, for the thousands of people who are caring for their loved ones. FDA makes a decision about whether it's effective and safe to put this drug out on the market. Centers for Medicare and Medicaid Services has to make a determination whether or not something like that drug will get covered under Medicare. Two different agencies have two different platforms to work under. We're going through the process. We hope very, very soon we will get CMS's word on what will happen in terms of coverage determination. We are also going to hear very soon about the request I made to have a reevaluation of the cost. Once we get that, we will report to you as quickly as possible. I think that'll come very soon. I can't give you the precise date because I don't drive that. The science drives that, but I'll do it soon.
Thank you. Thank you. I mean, I think this is actually an unprecedented effort, but again, given the price pressure that seniors are facing right now, I think really any relief would be very welcome, and I've certainly heard that from my constituents. Another part of the budget that came over in that discretionary spending was efforts to address the opioid issue. Again, COVID sort of took over the the healthcare coverage, public health coverage, but they're really that continuing epidemic of overdose, plague that's taken over this country is continuous. It's like colliding epidemics. And I was wondering if you could talk about what the budget is focused on in terms of dealing with that second crisis for so many Americans, which again in Eastern Connecticut is very real.
Yeah. And we've seen it sweep from the Northeast into the rest of the country. And it's not getting better. COVID has just exacerbated things. In fact, COVID exposed how bad it really was in parts of the country. We are working with your support in the American Rescue Plan. We are now able to do far more in trying to help communities deal with opioid addiction. One of the things we did early on, less than a year ago, was to provide $3 billion in immediate support because of your efforts on the American Rescue Plan, where half of that money went to mental health services because of the increasing stress we see people are facing mentally, but half of it was also for drug overdose and drug addiction. And so we wanted to channel that as quickly as we could. We also took a very important second step, Congressman Courtney, which I'm sure you're aware of. We changed the paradigm on our drug strategy. We're getting rid of the taboos, we're getting rid of the old way of thinking, and we're using science to drive where we go because we want to not only save a life right before they overdose, but we want to keep them from harming themselves as they try to get past the addiction. So harm reduction is now one of the principal components of our strategy, along with post-treatment follow-up. So we make sure we're keeping track of you. We don't just, like FedEx, drop off the medicine to help you and then, scoot out of town.
Thank you. The gentlelady from North Carolina, the distinguished ranking member of the committee, Dr. Fox.
Thank you, Mr. Chairman. Mr. Secretary, I hope your answers to my questions will be a little more complete than your responses from last year. I've asked you this question several times, and I expect a substantive response today. And as you know, we're going very quickly through this hearing if we can, so I'd appreciate succinct answers. The statute authorizing the FDA's temporary emergency use authorizations for COVID-19 vaccines include a provision that individuals must be informed, quote, of the option to accept or refuse administration of the product of the consequences, if any, of refusing administration of the product and of the alternatives to the product that are available and of their benefits and risk, end quote. That's in the statute. Would allowing states' public officials in schools to mandate vaccinations violate the statute, which allows the patient the option to refuse? Yes or no?
Congresswoman, are you asking if the mandates, any requirements would be imposed by states, or if those are legal, or if any requirements imposed by the federal government?
Do they violate the statute?
If you're speaking about any requirements by state or local governments, I'm not going to try to venture into saying what they did and whether under their laws they are legal. I can tell you what we did at the federal level.
Does it violate the federal statute? Yes or no?
Congresswoman, I'm trying to respond to you. If you're asking me about state law, I don't represent a particular state. I represent the federal
I understand.
government.
That's why I'm asking you the question. You represent the federal government. Can the states pass a law that contradicts federal law?
The states can pass laws where they have jurisdiction. If there is a conflict, then the courts will decide if there is a ability for the state to enact laws.
So you're saying the federal government had no jurisdiction to pass this law?
No, that's not what I'm saying.
Okay. I'm going on to my second question. The recent proposed rule on benefits and payments makes gender transition procedures an essential health benefit offered by all exchange plans. The proposed rule could force some medical professionals to violate their expertise or beliefs on the best care plan for individuals, particularly children seeking gender transition medical services. Your administration continues to double down on this policy by clearly targeting states like Texas, which seek to protect minors from life-altering and irreversible surgeries and unnecessary treatments. What safe harbors are included in the proposed rule for religious providers or other entities that have objections to administering gender transition treatments and surgeries on minors?
Congressman, one of my duties and one of my former duties as the Attorney General in my state of California was to not only enforce the law, but to comply with the law. As Secretary, that's what I'm doing now. I'm not only complying with the law, but enforcing the law. If someone remains within the confines of the law, there can be no action taken against them. We certainly, when it comes to Americans' rights, whether you're transgender or not, we will enforce your rights to be protected. And we will do everything we can for the transgender community, especially our youth, to know that they will have their rights protected.
Well, you're not answering the question, so let me go on to my third question. So you don't answer the questions on the safe harbor. So we thank you for the administration's work to implement the No Surprises Act, which was intended to put an end to an exorbitant charges from out-of-network health care providers and to begin lowering costs for families. Unfortunately, litigation has caused a delay in the implementation of this important law. You have said the administration will issue revised rules in May. Can you commit to that timeline to ensure certainty in the healthcare marketplace? In the revised rule, will you commit to implementing the law in a way that limits overuse and abuse of the arbitration system and does not drive inflation in healthcare costs?
Congresswoman, first, thank you very much for the support that Congress gave for this No Surprises Act law, which we are now implementing. We will make sure that what we put out is something that helps us avoid the costly process of arbitration. We think we have rules that will be in place that will not only help avoid that type of litigation, but will protect the rights of individual patients, not be blindsided by these bills that they get after they've left the hospital or medical center. And so we will work with you where we can to improve the law, and we will implement based on what you provided us in statutory instructions.
Well, this is a purely bipartisan issue. The chairman and I worked hard on it, and we'd like to see it implemented appropriately. Thank you, Mr. Chairman.
Thank you. Gentlelady from Oregon, Ms. Bonamici.
Thank you, Mr. Chairman. Mr. Secretary, nice to see you. Thank you for your service and your work. I'm going to ask you about 3 issues, and I'll put them all out there and then let you answer each of them. Student behavioral health, childcare, and nursing homes. And we know the pandemic didn't affect all students equally, and a recent JAMA pediatric study found that depression and anxiety doubled It's a serious issue with students. In Oregon, the University of Oregon is opening the Balmer Institute for Children's Behavioral Health, which is going to be, I think, a model for the country, working with our K-12 system. I appreciate the President's budget process and investments in behavioral health and the project-aware state grants. But what additional steps can Congress take to support efforts at HHS in partnership with local communities to address complex mental health challenges facing students? That's the first question. The second one is about childcare. The American Rescue Plan Act had the $39 billion for childcare, which is particularly important from children from underserved communities, but also provides, as you know, critical support for parents. Yet there's still a gap between the cost of care and what parents can afford to pay. So how have states spent these dollars? What can we do to stabilize the childcare system? And why is it important to provide a living wage for childcare, preschool, and Head Start workers as part of making systemic improvements in the care economy? And number three, the Biden administration unveiled its nursing home reform proposal, focusing on setting minimum staffing requirements and taking aim at private equity ownership. So how will these proposals lead to better treatment in the nursing homes, and how can we raise standards without reducing access? And what you can't answer in the time, please submit for the record. Thank you, Mr. Secretary.
That was a mouthful, Congresswoman. Let me see what I can get through. First, behavioral health. You know, the President made this one of his priorities. He mentioned it in the State of the Union. We are working vigorously to try to implement all what the President wants, especially for kids. You're probably aware of the close to $250 million that we're investing in the Project Aware program for state grants. That money will be used to help states train teachers, parents, first responders, so we can move towards youth mental health services. And so that will be important for your state and others to have capacities to address those needs. We know that because of COVID, the crisis has expanded. When you have 100,000 Americans die from overdose, you know that something is wrong. We're getting ready to implement the 988 three-digit lifeline for all Americans, so that if they are willing to move in the different direction rather than go the route of committing suicide, but call someone and ask for help, we want to make sure that if they call the 988 number, they don't get a busy signal or are put on hold. So we'll do everything we can to try to help on behavioral health issues, especially for our youth. Childcare, if we had Build Back Better, I could tell you a whole lot more, because we're so shy. So many American families, parents have had to let go of their jobs so they can care for their kids during the pandemic. We're now getting out of that, but still, the crisis is there. We don't pay enough for our child care workers. The President's plan, and so far the budget does provide us some monies, $39 billion we put out there through your help in the American Rescue Plan to help on child care relief. It's not enough. The issue is so big. Child care is very expensive for parents, and it's very difficult for states because of the constraints they have. And finally, nursing home. The President made it very clear. We're gonna do much more oversight on nursing homes, and we're going to make sure that staffing levels are improved. So we look forward to working with you, because we got a clear direction from the President. We're going to make this work.
Thank you. You did a great job, Mr. Secretary, answering the questions. I am introducing a resolution today emphasizing the importance of those child care investments. It's important for not only the children and the families, but also for the economy. And with the nursing home question, there's still a bit of time left, and I want to really focus on how the proposals can lead to better treatment in nursing homes and other long-term care facilities, raising standards without reducing access. Do you have thoughts on that?
This is a tough area. I'm not going to say that we have clear answers, but we're not going to lower standards. We're going to try to continue to raise them.
It's important.
The difficulty is for some of these facilities, it will cost them money to get there.
Correct.
To improve services, we have to have more professionally trained individuals. That costs money. That's why we're ready to help. We want to provide support and assistance. But we also know that there are a whole bunch of folks who are making a ton of money in nursing home care and not doing a very good job of it. And that's where we want to extract that inefficiency, sometimes the fraud. We're going to continue to do program integrity to make sure we're getting real money and real results for the money we put in. Thank
you very much, Mr. Secretary. And Mr. Chairman, as I yield back, I just want to thank Jack Arriaga from my staff, who's leaving the team after more than 10 years to move back to Oregon, and I just want to appreciate his work.
Thank you. Gentleman from South Carolina, Mr. Wilson.
Thank you, Mr. Chairman, and Mr. Secretary, welcome back, and it's good to see alumni do well.
Thank you.
And so we're happy for your success.
Thank you.
Mr. Secretary, I strongly support the expansion of association health plans, which allows small businesses and those who are self-employed to join together to obtain health coverage for employees. These plans can reduce costs, allow coverage across state lines, provide more choices, and be better suited to meet the needs of employees. The Department of Labor, under the Trump administration, issued a rule to allow association health plans to be used across state lines and allow more small businesses to participate. Both the U.S. Chamber and the Society for Human Resources Management have urged the Biden administration to allow the rule on association health plans to move forward. You've really, in the past, called association health plans junk health plans. How does the Biden administration intend to support the ability of small businesses to provide health coverage to their employees?
I'm sorry, Congressman, what was the question?
And that is, how does the Biden administration intend to support the ability of small businesses to provide health coverage for their employees?
Yeah, Congressman, thank you for the question. The Affordable Care Act made many accommodations for small businesses. We intend to make sure that all small businesses can not only provide their employees with a quality plan, but they can do so and continue to operate and do what we all want them to do, is make a profit. What we don't want is for individuals in this country to be offered plans that offer them no protection at low rates. You pay very little up front, but then when you really need the plan, you get nothing. That's why we call them junk insurance plans.
Hey, and I hope you'll really look into it even further. The association health plans that I'm familiar with have just been very successful, and then sadly, with the ACA, the premiums have just been astronomical. And so, but please look into it.
Okay.
Additionally, last year I noted to you how grateful I was that HHS is taking initiatives to increase cybersecurity for radiation dose reconstruction program affecting claimants under the Energy Employees Occupational Illness Compensation Program Act. Unfortunately, as a result, the National Institute for Occupational Health and Safety and Health has established a temporary moratorium on completing these dose reconstructions. How has the moratorium been lifted? If not, what is the timeline and plan for lifting the moratorium? This is a key process for many claimants with cancer, and the moratorium means that workers from, like at the Savannah River site of South Carolina and Georgia that I represent, are unable to proceed with their claims.
Yeah. Congressman, you know what, I want to make sure we commit to continue to work with you on this because I share the concerns that you've expressed. As you're aware, we completed the first phase back in September of this initiative to try to make sure that we are protecting the data that comes in. We don't want any type of slippage to occur and have any kind of cybersecurity threat occur with very sensitive data. But we'll work with you because we know that the claims that are being submitted, whether folks at Savannah, Georgia, or otherwise, Savannah River site or otherwise, are crucial to make sure we process properly.
Well, again, we have such, hey, I'm the only person in Congress that's ever worked at the Savannah River site, so I know the dedication of the people who work there, and it's just so inspiring in their services, particularly as we face an incredible threat from Putin that we need to make sure that our nuclear deterrence is there for peace through strength.
Right, agree.
I have represented Allendale County, South Carolina, which is the second poorest county in America, and it's distant from modern health facilities. But we've all seen the importance of access to telemedicine during the pandemic. Laws enacted during the early days of the pandemic allowed for flexibilities in how, when, and whom telehealth could be utilized in Medicare and employer-sponsored coverage. The changes in Medicare and employer-sponsored coverage were recently extended through the end of the year by Congress in the Omnibus Funding Bill. Does the administration support a continuation of these flexibilities beyond December 2022, in particular, those that allow employers to offer telehealth at no cost to their employees?
Congressman, we are very supportive of expanding the telehealth services that we now see being provided as a result of the public health emergency, as a result of the pandemic. We need further authorities from you, and thank you for those who supported the omnibus bill because it provided a 5-month extension to the use of those telehealth authorities. We hope that you will continue to work to give us some of those authorities so we can expand permanently access to telehealth services for so many Americans, especially in rural parts of our country.
And we've seen success already at the University of South Carolina with handheld ultrasound. And so I hope that's expanded. Thank you. I yield back.
Thank you.
Thank you. The gentleman from the Northern Mariana Islands, Mr. Sablan.
Yeah, thank you very much, Chairman Scott. Secretary, welcome. It's very good to see you, and I hope you're doing well. The Department of Health and Human Services is a huge and very important federal department, as you know, Mr. Secretary. So we often interact with your team on issues of literally life and death of importance to my constituents. And I have a long list of thank you. I want to thank you first for your decision to read Public Law 116-94 correctly, the permanent increase in Medicaid funding cap for the Marianas and other insular areas. Thank you for that, Mr. Secretary. And thank you as well for the President's commitment in this fiscal year 23 budget to lifting the Medicaid cap entirely and treating the insular areas the same as state in setting the FMAP. Thank you as well. Your congressional staff, Kimberly Espinosa and Leslie Zelenko, helped the Marianas when the President rolled out the free test by mail program. Because we don't have postal delivery in the Marianas, there were hurdles to getting those free tests sent to my constituents, but your staff helped with the fix. We're now working with Ms. Sharon Yee at your San Francisco office on the free testing for Medicare Part B beneficiaries that you announced. We do not have a CVS or a Walgreens or any of the chains, so we're confirming with our local pharmacies that they will be participating. And lastly, I had a very good briefing just last week with Mr. Kurt Johnson, the financial officer of SAMHSA, as we try to keep one of our local grant recipients in line with HHS regulations. Again, your team is very helpful and responsible. Mr. Secretary, you know, presumptive eligibility under Medicaid cannot go on forever, but you have not announced an end. I just want you to know, Secretary Basara, how important that policy of presumptive eligibility has been to my constituents and to the delivery of health care in the Marianas. Turning now to early childhood education, the budget requests of $505 million of new funding for a cost of living increase to allow Head Start programs to keep pace with inflation without diminishing quality. The budget request also includes $950 million to expand access to high quality early learning opportunities, including birth to 5 programming, increasing the number of available slots for Head Starts and early Head Start programs for over 48,000 children and families. And so my question, Mr. Secretary, is the Administration for Children and Families regularly measures the quality of Head Start classrooms through the Classroom Assessment Scoring System, CLAS, but suspended this review, obviously because of the pandemic. So what is the department's plan to ensure children placed in Head Start classrooms are provided a quality education?
Congressman Sablan, first, if I may begin by saying it's always good to see you. Thank you for all the work that you have done. What you do helps not only your constituents, but it helps all those constituents in the territories of this country. So I thank you for the work that you've done. On the issue of our kids in our schools, we're going to do everything we can to continue to support the states who have jurisdiction over the way our schools are run and the local school districts to make sure that we can provide them the resources and help that we need. I should point out one of the things we're hoping to do is finally get healthcare professionals back into our schools, because we've seen how important it is to keep our kids not just safe but healthy. And so we will look forward to working with you on any proposals you might have on how we can advance the interests of our children returning back to schools. And I want to be mindful of my time, but we can follow up with specifics to you, but I want to be mindful of the time in case you have other questions.
No, I don't, Secretary Basara, but thank you for that response, and we'll stay in touch as well. Best wishes, sir. Mr. Chairman, I yield back.
Thank you. Thank you. The gentleman from Pennsylvania, Mr. Thompson.
Thank you, Chairman. Mr. Secretary, I appreciate you taking the time to be with us today. It's good to see you. As an experienced therapist, rehabilitation services manager, and a licensed nursing home administrator in rural areas, I've witnessed firsthand the importance of strong doctor-patient relationships and tailored healthcare delivery, particularly in rural areas such as those within the Pennsylvania 15th Congressional District. Expanded access to telehealth and telemedicine is vital to providing care when physical facilities could be miles away. Prior to the COVID-19 pandemic, healthcare providers began to expand their capacity to deliver health services remotely to their patients. The original intent of these services was twofold: to supplement in-person care for individuals in underserved or hard-to-reach areas, and to supplant in-person care for patients who prefer using technology to access their healthcare services. However, the COVID-19 pandemic has laid bare the critical and immediate need for expanded access to telehealth and telemedicine services throughout the country. In the CARES Act and the subsequent COVID-19 packages, Medicare, Medicaid, and private health insurance plans were required to temporarily require or increase payments for telehealth services related to COVID-19 treatment or testing, diagnosis, or treatment. Now, these packages also waived other telehealth restrictions and encouraged the use of telehealth to provide access to care. Now, while this was an important and necessary first step towards expanding these services, I believe we must continue to advance the progress that we've made over the past 2 years. Now, for these reasons, I was proud to introduce H.R. 4437, the Helping Ensure Access to the Local Telehealth Act, or Health Act, which builds off the provisions found in previously passed COVID-19 packages. Specifically, the bill codifies Medicare reimbursement for telehealth services rendered by community health centers and rural clinics. It removes the geographic restrictions related to originating sites where the telehealth distance site provider is a federally qualified health center or rural health clinic, and it allows these health facilities to continue to utilize audio-only telehealth visits for patients who don't have access to quality broadband. Ms. Secretary, I hope you agree that the ability to use telehealth services during this crisis has demonstrated how this technology can play a pivotal role in improving health equity by increasing access to care for the vulnerable populations. And as we look beyond the pandemic, Ms. Secretary, does the administration support a continuation of these flexibilities on a permanent basis?
Congressman, first, I applaud you for being interested and putting those thoughts into paper and legislation to help us on telehealth. We hope that we can work with you to make some of those authorities permanent. We agree with you that many of them are critical for communities to move forward. We hope that you will also look at the way we can make sure that everyone is accountable, because moving towards telehealth could become a way that some try to abuse the system, take advantage of it. And we want to make sure that they don't ruin it for all the folks that really do need telehealth services. So we're looking forward to working with you to expand access to telehealth services, but to make sure it's also done properly so that taxpayers and those patients aren't abused.
And absolutely, that's something we should be doing throughout all of healthcare, having practiced healthcare for 28 years before coming to Congress. I mean, we've seen that with other things. Some folks who try to take advantage of Medicare billing with some durable medical equipment that, quite frankly, they were just there to bill the patient, not really to provide proper care. I mean, this is always a part of the healthcare system that we need to manage and mitigate, right?
That's
right.
It
should not prevent us from moving ahead with the innovation this technology provides us. Ms. Secretary, just one last quick. I'm really deeply disappointed that the administration's budget once again did not include the Hyde Amendment, which prohibits the use of federal funds to pay for abortions. You know, the Hyde Amendment has saved an estimated 2.4 million lives since 1976. How can you tell 2.4 million Americans that our country would be better off if they were not born or allowed to live their lives? And so I'm hoping and I'm praying for the Biden administration to be able to see just how wrong it is to not support what has been a long-standing bipartisan part of the federal government in the form of the Hyde Amendment.
Congressman, if I can respond, this is one of those areas where we always have a lot of discussion. There are deeply held beliefs in this space, and I respect all of that. My job now as a secretary versus as a member of Congress is to now make sure that I'm exercising my duties to execute the law. And so we're going to try to do it as best we can, staying within the confines of the law and making sure we protect those rights that people have under the law. And so I look forward to working with you. I believe it's very important that women have all their reproductive rights protected, but we can have that conversation and hopefully get to a good spot.
Well, let's remember that the rights of those 2.4 million that would have not have life if it wouldn't have been for the Hyde administration. Thank you, Mr. Chairman. I yield back.
Thank you. The gentleman from California, Mr. Takano.
Thank you, Mr. Chairman. Good morning, Mr. Secretary. As you know, we both come from Southern California, and California as a state and many parts of the country are experiencing astronomical levels of homelessness. Do you agree with me that that the pandemic has contributed to, I think, the crisis that we were seeing in California?
Without a doubt.
Without a doubt. Mental health and addiction, big part of the issue as well?
Without a doubt.
The Boise decision, and it's a federal decision, a federal court decision. I'm hearing from my local services, the police, the county folks, that the refusal of services by homeless people is a big part of the challenge. Have you given much thought to this?
I will tell you, Congressman, and by the way, great to see you again, but I will tell you that when I was the Attorney General in the state of California, I worked quite a bit with law enforcement. We were looking for ways to try to tackle this, working with the mental health service providers, with social services, because we knew that law enforcement wasn't always going to be the best first responder to some of the crises that we see. But I mean, as Secretary, we don't deal with it as directly because my jurisdiction is not directly over homelessness in local communities.
Thank you. I wondered what it was, and I thank you for reminding me of your background as Attorney General, and also your insight that the police departments aren't necessarily the first line of defense. But
they'll tell you that.
I ask you these questions because addiction and mental health were part of the President's unity agenda, and I'm wondering how it is your department, if at all, because you have these, how you can coordinate that with HUD or other places, or if the administration needs to rethink the department's role.
So, Congressman, we're actually doing a lot in this space, but we don't have direct jurisdiction over homelessness issues. So, for example, we changed the entire paradigm for drug use, overdose strategy.
Excuse me for interrupting, but who does have direct jurisdiction?
That's mostly a local issue. The federal government can support, for example, HUD can deal with some of the issues of housing, but not as directly.
Well, thank you. You know, one thing I'd like to clear up is that, as you know, there's some unspent ARP funds at the state and local levels. I'm urging folks to get creative in how they use this one-time money, because that can't be embedded in police salaries, et cetera. But, you know, I've got businesses that were broken into, medical offices, actually, because I think homeless people are looking for maybe drugs, or they're looking just for a place to go to the bathroom. This is not a question I wanted to sort of get it out there, but is there a creative way for ARP funds to be used to kind of help these small businesses as well as the homeless people in the short term while we're looking for a longer term solution?
Absolutely, and we've been trying to do some of that at HHS. We have been trying to support really innovative proposals and programs on the ground locally. We can do some of that through demonstration projects or pilot programs. We don't fund the entire program. We can't do it nationwide, but we can target. If it works, we can come back to you and say, here's a great program that works.
Well, I think the one connection that the feds and the locals, I mean, even though it's local jurisdiction and state and local, the feds can be supportive is I'm hearing that there's a shortage of beds for addiction services. There's a shortage of mental health professionals. How do we get the facilities and the workforce stood up quickly? Speed is of the essence. We can't allow this problem to keep festering.
Congressman, that's why we took $3 billion of the American Rescue Plan money that you made available to us, and we put $1.5 billion into mental health services immediately throughout the country, and another $1.5 billion into drug use, addiction use right away, services right away. And what that was meant to do is help the locals determine locally what was best for them versus having Washington tell them what to do with it. We monitor the money, we hold them accountable, but we try to let them use their best practices to move forward. Obviously, it's not enough. We're doing more. We changed our drug strategy altogether to make sure that we deal not just with addiction, but we deal with harm reduction, we deal with treatment, and post-care services as well, so we follow folks all the way through.
Well, I certainly hope that you'll work with those of us back in California where you've come from to find ways, creative ways to stand up the mental health workforce quickly, specifically to serve our homelessness, our youth that have survived, our teenagers that have gone through a lot. My time is up. There's so many more questions, but always good to see you, sir.
Great to see you.
Thank you. The gentleman from Michigan, Mr. Wahlberg.
Thank you, Mr. Chairman, and welcome back, Mr. Secretary, to a great committee room. Mr. Secretary, the administration has requested an additional $22.5 billion to purchase COVID-19 vaccinations, testing, and therapeutics. Currently, all COVID-19 vaccines are purchased by the federal government, but as the pandemic winds down, there needs to be an off-ramp, I believe, that transitions this responsibility to the private market. Insurers will need to establish new contracts and negotiate prices to purchase these supplies, which will take some time. And so my question, simple question, has the administration begun to discuss this transition with insurers, yes or no?
Yes.
Thank you. Keep it up. Mr. Secretary, when the public health emergency ends, many people who no longer qualify for Medicaid will have their coverage terminated. The Urban Institute estimates that 65% of these individuals will qualify for employer-sponsored insurance, which most people like. What is your administration doing to ensure that these individuals are aware of their private coverage options, which are not on the ACA exchanges? And second, how much time does the administration plan to give healthcare payers to ensure smooth handoffs and guarantee that individuals don't become uninsured?
Congressman, thank you for the question. Great question. So we are working with every state. We're trying to get them ready. We're trying to prepare them. We've committed to give at least 60-day notice on that public health emergency pull down. We're going to try to work with them to make sure that they're aware of all the options that these folks have, because you're right, there are millions of Americans who are getting health insurance through Medicaid who might lose it, many of whom, as you just acknowledged, will actually qualify to whether it's employer-based health insurance or whether it's the Affordable Care Act insurance or perhaps stay on Medicaid. We want to make sure that they're aware of it. So we're working with states. We could use your help if you could encourage your state leaders to stay in touch with us so we can make sure that we're coordinating with each state as they look at the population that might lose coverage.
Will do. I appreciate that. And again, the private sector employer-sponsored insurance is overwhelmingly accepted and approved.
Yes, it is.
And if 65% of these individuals are capable of receiving that, we need that to take place.
And it's good news. That means they're working, so that means they can, pay for their insurance as well.
Yeah. Switching to another topic, faith-based organizations play an indispensable role as subrecipients of CAPTA and CSBG grants and have a long history, as you know, of service in the United States, of serving Americans to help uplift them from poverty. In fact, more than 50% of the families that choose center-based care choose religious-based programs. Mr. Secretary, do you think faith-based organizations should still be included among recipients to help carry out Congress's goals to help in child abuse prevention and to alleviate poverty?
Absolutely. Absolutely. In fact, they probably are one of the dominant forces in helping us address those things.
I'm delighted to hear that. I agree with you. And so what steps will you take at HHS to ensure that these faith-based organizations are able to continue to maintain their religious character while continuing to participate in helping children and families? And this, of course, is a First Amendment concern.
Congressman, first, can I just say thank you for the way you've asked the question, because there will be areas where there will be some conflict in policy. But what I will tell you—
to say the least.
Yeah, but without a doubt, the charitable work that's done by these faith-based organizations, we cannot replace it. And it would cost a ton of money for you all to figure out a way to replace it. So we have to continue to work with all those organizations that have committed themselves to help humanity. And what we will do is make sure that we are as supportive as we can be, but we also want to make sure that we follow the law. We want to make sure everyone follows the law. And sometimes when there's a conflict, we'll have to turn to the law, whether it's through the courts or through you, to determine how we do that. But no one should have their rights violated simply because the care is being provided in ways that would discriminate against them.
I agree. And to simply fall toward the Constitution and the law is the best way to handle it. The American people are committed, I believe, to helping protect American children from child abuse, assisting as many Americans as possible from falling into poverty. Faith-based organizations are essential providers in carrying out that mission. And although you testified to the importance of enforcing conscience and religious freedom rights under oath in your nomination hearings, and we remember that and hoped that was solid.
I'm committed to that.
Your actions contradict this to some degree in carrying out the law and the Constitution. So I'd call you back to that, and we'll be watching and hoping for the best there for religious liberty. Thank you. I yield back.
Please do so. Please do so.
Thank you. The gentlelady from North Carolina, Ms. Adams.
Thank you, Mr. Chairman and Ranking Member, for hosting the hearing. Mr. Secretary, let me first of all thank you for your partnership and for supporting priorities that are important to me and the people of the district that I represent in North Carolina. And I did want to thank you for taking time to visit me in Charlotte last July. You might remember during that visit, we talked about the importance of making long-term investments in our future, and those investments are what I want to ask you about today, specifically to focus on the National Institute for Occupational Safety and Health, NICE. As you know, this is the only agency in the federal government tasked with research about the health and safety hazards faced by America's workers. The analytical perspectives volume of the president's budget submission says that the next fiscal year provides a critical opportunity to invest in the staff capacity and infrastructure needed to ensure that evidence is used to inform decision-making across the government. So you and I both care a great deal about the vitality of America's workforce. My question is, do you agree that NICE plays a valuable role in providing evidence that can inform decision-making on workplace health and safety?
Congressman, I apologize. I did not hear everything in your question. If you could, it's hard to make out some of what you're saying. If you could just repeat the question.
Okay. Do you agree that NICE plays a valuable role in providing evidence that can inform decision-making on workplace health and safety?
Without a doubt. If we didn't have NIOSH producing some of the data, the actions we would be taking at the work site would not be as informed. And so absolutely, we need to protect workers, not just their safety, but their health. And NIOSH is indispensable in making that happen. And by the way, I want to make sure it's clear. When we formulated the budget that the president presented, this was before we knew that Congress would pass the omnibus budget bill. We had to base our projections on what we had through the continuing resolution, which, as you know, were far less in funding for all the programs. And so and many items in the budget, they're reflected based on what we thought was going to be the case based on the continuing resolution. Obviously, the omnibus gave us more dollars, and so we're prepared to work with Congress and with the Department of Labor to make sure that we are sufficiently funding programs like NIOSH.
Right. So your current budget proposal, though, calls for $6.5 million reduction in funding for NICE compared to the 2022. So is that the reason?
And that reflects the fact that if you take a look at what the continuing resolution was funding us at the current level, we had to base any projections for the next fiscal year for 2023 off of the current funding we had through the continuing resolution. And as you know, the CR had very low funding levels. Now we can work forward based on what we got through the omnibus. The omnibus had a higher level of funding for these programs. So now we can make our projections based on the omnibus, not the CR. And that's why I'm saying we're willing to work with you to make sure that NIOSH is properly funded.
Great. So let me ask you about ACA. You know, the 12th anniversary, we just marked that. We know that there are gaps in coverage that still exist. In my state, we have over 500,000 who are still without access to health coverage. So how will HHS continue to build on the successes of the ACA and further advance the administration's key priorities of expanding healthcare access, reducing healthcare costs, and reducing health disparities.
Congressman, I know this is an important issue for you, and it is for me as well. We are doing everything with the lens of equity involved, and that's why, for example, when it came to the open enrollment period under the too many folks in our communities don't understand all the avenues they can use to get good coverage, have never been given a chance to get familiar with good quality health insurance plans. And so with these navigators, by quadrupling them, we were not only able to help people understand what their rights and their benefits could be, but also help them navigate the process of getting to the best plan for them, not getting more coverage than they need, but not getting less. And that's one of the reasons why we saw a major uptick in the number of Black and Latinos who signed up for affordable care under the ACA.
Great. Thank you, Mr. Secretary. We really appreciate you being here. Mr. Chairman, I yield back.
Thank you. Thank you. The gentleman from Indiana, Mr. Banks.
Secretary Basara, during a House Energy and Commerce Committee hearing on May 12 of last year, you were asked whether you would enforce the partial birth abortion ban of 2003, which prohibits abortion providers from murdering a child after it is born. 3 different representatives asked you if you would uphold that law, to which you outright lied to them, saying there was no law that prohibited partial birth abortion. And then you dodged the following questions. Your failure to uphold this law is made more drastic by the fact that not only do you know that this law exists, you voted against it as a member of Congress in 2003. When myself and 157 other members of Congress wrote you a letter about this issue in July of 2021, you showed contempt for every single member when you sent a reply, which was only 2 sentences long and refused to acknowledge either the law or the questions at hand. So now I'm going to ask you, do you concede that partial birth abortion as defined in 18 U.S. Code Section 1531 is illegal and punishable by fine, imprisonment, or both?
Congressman, I'll try to respond to this as best I can, as I did before, and that's to say to you that having been a former Attorney General, I know how important it is to not only follow law, but enforce it. As Secretary of HHS, I will not only comply with the law, but enforce it. And when it comes to issues that sometimes we hold different and sometimes very deeply held beliefs, I will respect where people's opinion is, but my job is to make sure I'm enforcing the law.
Do you concede that partial birth abortion is illegal per the law?
Under the Supreme Court decision in Roe versus Wade, women have reproductive rights that they are entitled to enforce and that they are entitled to have the government respect. I will do everything I can to make sure a woman's rights in reproductive care are defended.
So I take that as a no. You don't concede that that is the law.
I gave you the answer.
18 U.S. Code 1531, it seems pretty clear. You voted against it. You're well aware of the law, so you don't concede that partial birth abortion is illegal.
As I said, I understand that there are differences of opinion.
It's a simple question. Will you commit as Secretary of the HHS to ensure that the department acts in accordance with the Supreme Court decision to uphold the ban on partial birth abortions decided in Gonzalez versus Carhart?
I am obligated as the Secretary of Health and Human Services to make sure that I am complying with the law, and that's what we will do.
Will you commit as the Secretary of HHS to full oversight of HHS grant programs to ensure no grantees who violate 18 U.S. Code Section 1531 continue to receive HHS funding?
We will do everything we can to make sure we do vigorous oversight over all the programs that are under the jurisdiction of HHS.
Last year, the University of Pittsburgh implied that one of its federally funded research projects utilized organs that might have been extracted from live fetuses. Secretary Basara, will HHS investigate the University of Pittsburgh's grotesque violation of the partial birth abortion ban?
Congressman, we know that there are practices and standards that must be followed when it comes to fetal tissue, and we will make sure we do everything we can to make sure those practices and standards are followed.
So you just told me you're going to follow the law, but why haven't we yet investigated this clear violation of the law?
You're more than welcome to submit to us any information you have on any potential violation of the law, and we will definitely make sure that we look into it.
Secretary, 157 of us sent you a letter and you gave us a non-response, so how can we be sure that you will look into this clear violation of the law?
I responded to your letter, Congressman, and we will always respond to your letters as best we can.
On October 4, 2021, the Department of Health and Human Services issued a final rule that allows Title X family planning funding to flow to organizations that provide elective abortion. This decision overturned a rule issued by President Trump known as the Protect Life Rule. According to a 2021 GAO report, between 2016 and 18, before the Protect Life Rule was established, Title X funds were Planned Parenthood's second largest federal funding stream at $182 million, approximately $60 million each year. Secretary Basara, do you believe that federal taxpayer dollars should be used to fund abortion? Yes or no?
Congress, I know this issue well. I worked it when I was the Attorney General. I want to make sure that the rights of women were protected and the rights of families to receive family practice services were protected.
But should taxpayers pay for it?
The taxpayers have provided money for family planning. We make sure that that's...
Should taxpayers pay for abortions?
The taxpayer money is being used the way it should be lawfully.
Simple question, yes or no? Should taxpayer dollars be used to pay for abortions?
I think I'm responding to your question, Congressman, by telling you that we use Title X funds the way we're allowed to under the law.
I yield back.
Thank you. The gentleman from New York, Mr. Morelli.
Thank you so much, Mr. Chairman, for holding this hearing, and Mr. Secretary, thanks so much for being here. I'm proud of the budget request that HHS has put out. It's clear you and the President are focused on the pressing health care needs of families across the country, and I look forward to working with you to make meaningful progress on driving quality and promoting the well-being of all Americans. So I want to congratulate you on that. I want to ask you a little bit about an issue I'm focused on back in Rochester, New York, where I have the privilege of representing Monroe County, that relates to addressing social determinants of health and how we deliver services. So I was very glad to see considerable mention of these factors in your budget request, both in terms of dollars and an emphasis on specific outcomes in areas such as maternal health, chronic diseases such as high blood pressure. So I also applaud the coverage and reimbursement of services provided to community health workers and community-based organizations, giving their impact on addressing social determinants and improving health equity, which you've mentioned earlier. So I would just like to welcome the opportunity to work with your team on a project I lead in my community that seeks to better connect healthcare, housing, food and food insecurities, employment and education providers. We are working on an effort to create a truly integrated health, education, and human services delivery system that engages people early on who are in crisis with an effort to improve outcomes, reduce costs, and we would welcome the opportunity. May I follow up with your office on that, sir?
Absolutely, and if you look at the budget, we have an allocation in CDC to actually deal with social determinants of health. We look forward to working with you on that.
Good, I will follow up if I might, sir. I also want to just mention local hospitals have been essential to our communities clearly during the last 2 years. It's really shown both in terms of emergency care, COVID-related care, and people, they continue those hospitals and navigate subsequent surges as they happen. So each of us should be grateful for their continued work in keeping our communities healthy and should be doing everything we can to ensure their fiscal health and that they have the resources to serve their patients in those areas, particularly in underserved areas. So I was pleased to see in your budget $17.2 million to support the 340B drug pricing program, administrative support to improve operations and oversight of the program. However, I do want to highlight an issue that I've engaged with your department over the last several months. For hospitals that participate in the 340B program, the disproportionate share hospital eligibility has been negatively impacted by the change in payor makeup, as well as the inability to perform certain procedures during COVID. So there's that measurement that we use. So it's resulted in a number of hospitals losing eligibility and seeing the loss of considerable resources that go along with it. So I was proud to work with colleagues in the recently passed omnibus to ensure hospitals who lost their 340B eligibility have an opportunity to apply to be reinstated. And I have a hospital in my district currently looking to get reinstated. My question is, how can the historic investments included in the budget support the integrity and enforcement of the 340B program, especially around drug companies who've taken it upon themselves to limit savings through contract pharmacy arrangements? I'm sure you're aware of it. And how can we support community-based hospitals who are often serving the underserved communities? If you could just comment on that, sir.
I can, and I thank you for the work that you're doing on 340B. There are very few places where I go when I'm dealing with health care facilities where they don't come to me and say, can you please continue to work on 340B? It's indispensable for us to be able to get some of these medications to our patients. And so thank you for the work that you're doing. We're going to, as you know, we're going to work very hard and to the point where we know we'll probably end up in court on much of what we do. But we believe the 340B program was there for patients, not for manufacturers to make money. And we are going to do everything we can to make sure that when a medicine has to be dispensed, that those local pharmacies have the capacity to do so.
Well, thank you for that, and I appreciate that. I'll continue to work with your team. And just finally, just to underscore, I helped work on the No Surprise Act here. I worked on it when I was a member of the New York State Legislature and New York's law. And one of the things we were clear to do when we wrote the law is that the factors included in the IDR process should make sure that no one single factor is prioritized in such a way that it becomes a benchmark rate. That was the subject of the lawsuit. So I not only appreciate your commitment to working quickly on this, but also to make sure that the rulemaking is in line with the statutory instructions. So I'd like the opportunity to make sure we follow up with that as well, sir.
Look forward to following up with you on that. And if you'll recall, in our rule, we did have a provisions that said that when you look at that arbitration process, if a state has its own process in place, you fall back to that state's process.
And I do appreciate that very much and appreciate your leadership, sir. Thank you. I yield back.
Thank you.
Thank you. The gentleman from Georgia, Mr. Allen.
Thank you, Mr. Chairman, and Mr. Secretary, thank you for being here today. Yesterday, your administration announced a new rule to address the so-called family glitch in the Obamacare exchanges. Previous administrations have not found legal authority to address the family glitch, despite a push from liberal advocates. I'm concerned that this administration is taking steps to interpret a decade-old regulation and is now unilaterally expanding Obamacare at taxpayer expense. If this reinterpretation of statute is legal, why wasn't the family glitch addressed during the Obama administration?
Congressman, thank you for the question. And as you know, it's very important because hundreds of thousands, if not millions of families depend on us getting this right on the family glitch. There should be no family that has to forego coverage because the breadwinner, the person who's working, who has insurance, can access that insurance, but all of a sudden, because of certain glitches in the law, the family must be excluded from that policy. That makes no sense. We're going to do everything we can to make sure that that's correct.
How much is this going to cost taxpayers?
Well, we think it's going to help taxpayers because they're not going to have to worry about having family members without health insurance. And so we think, just as the Affordable Care Act has proven its success for more than 30 million people, that taxpayers are going to find that they're going to save themselves a lot of money by getting rid of these glitches in the law that leave their family loved ones behind.
So what you're stating here is that taxpayers paying through the IRS and through the federal government and then to provide money to the provider is less expensive than the individual in a private plan.
We've been able to bring down the cost of health insurance
Yeah, but you
coverage.
subsidize the cost, sir, with
That's
taxpayer money.
Which means that those...
That's how you bring the cost down.
Well, but those taxpayers now are insured and don't have to use the emergency room as their first level of care, which costs the taxpayers, as you know, billions of dollars, because that's care that's far more expensive than any actual preventative or primary care.
This change also impacts employer incentives to offer family coverage to employees, even though employer-sponsored family coverage is working for millions of Americans. Will employers now be forced to invade their employees' privacy by collecting information about total household income? Will employers now be subject to increased penalties?
Actually, I think most employers are going to be happy that we get rid of the family glitch, and we are going to make sure we protect everyone's privacy. And I say that not just as a secretary, but as the former attorney general who fought very hard for privacy protections for the people of California.
Okay, sir. Mr. Secretary, under the Biden administration's watch, we have a crisis at the border. And I don't know what y'all talk about at cabinet meetings, but I hope this is one of the subjects that you talk about. Obviously, you know, you're in charge of health care in this country, and these open borders have exasperated the opiate epidemic in this country. I mean, it's said that we've lost over 100,000 people to fentanyl, and there's enough fentanyl in this country to kill every American 7 times. In 2021, there was a 134% increase in fentanyl seizures at our border. And, you know, the administration barely allowed Title 42 public health order during the pandemic, but the CDC is now lifting Title 42. What is your position and what are you doing about the ongoing crisis of fentanyl pouring across our border as a obvious health risk? And have you spoken to the CDC about why they are removing Title 42 and discouraging that decision?
Carson, good question. You've mixed a lot of important policies into the question, so let me try to piece it out and deal with the four parts that we have direct jurisdiction over, and that is Title 42. Title 42, as you know, is a public health measure. It allows us, in extreme cases, to take actions which ordinarily the government wouldn't have the power to undertake, including, for example, under Title 42, quarantining populations because of the severe stress we're under because of, in this case, the pandemic. Title 42 must be based on the science and the facts on the ground in order to be able to survive a legal test. Title 42 has been in use, but CDC has been doing analysis on a constant basis about whether the science and the facts still exist to keep Title 42 standing. They have now reached the conclusion that those facts based on the healthcare, science and facts are no longer there to maintain.
Well, we have proof that there are health risks coming across our border, okay? I mean, we've got reports. Certainly, the administration must be privy to those reports, and we need to deal with it. One last quick question. I'm out of time. So, Mr. Secretary, thank you again, and I yield back.
Thank you.
Thank you, and I appreciate you refraining from that last question. We're on a very strict timeline. Thank you very much.
Yes, sir.
Gentlelady from Washington, Ms. Jayapal.
Thank you, Mr. Chairman, and welcome back to the House, Secretary Basara. It was great to see you yesterday. Thank you for your work on fixing the family glitch, which is going to lower costs for American people by bringing 1 million more Americans into health care coverage. 200,000 who are uninsured will finally get access to health care coverage. That was a really big step, Mr. Secretary, and I appreciate your work on that. On Title 42, thank you for following the science. I find it odd that my colleagues across the aisle would resist mask wearing or vaccinations and yet want to use a public health title. Title 42 is a public health title to keep immigrants out of the country. But we know that that is, unfortunately, the anti-immigrant sentiment is strong on the other side. Thank you for following the science and lifting Title 42. Also, thanks for all the incredible work that you've done to deliver COVID-19 vaccines and tests to patients throughout the country. You won't be surprised that I want to ask you about some of the profiteering that is happening with private insurance companies. Researchers have demonstrated that Medicare Advantage plans inflate patient risk scores to get larger payments from the Medicare Trust Fund, costing taxpayers over $50 billion a year. Your department's budget provides $2.5 billion to eliminate fraud and abuse in healthcare at the individual patient or physician level, resulting in a projected $10 billion in savings in traditional Medicare per year. However, Mr. Secretary, if we focused on Medicare Advantage risk score profiteering, we could save 5 times that amount. What plans do you have to stop fraud by these Medicare Advantage companies, and why is there no budget allocated for this much bigger problem of profiteering by private insurance companies?
Congresswoman, first, good to see you, and secondly, thank you for the work you've been doing. And on this issue, I hearken back to my days as AG, where we did everything we could to go after some of that abuse that was occurring, the fraudulent practices that cost patients and American taxpayers so much money. What I can tell you here is that we are going to make sure that when it comes to the Medicare program integrity will be one of the main priorities. We did include in our budget monies for program integrity so we can have a bigger capacity to go after that fraud. Oftentimes it's detected first at the state or local level, but because it's a Medicare program, which is federal, it then comes to us. So we're going to try to do what we can to work closely, as I did when I was AG, working closely with others to try to make sure we could take some action on this. Medicare Advantage, there are clear signs that in many ways the Medicare Advantage is not giving taxpayers the full deal that they're entitled to, and so we will try to work with you to make sure we can make advances there.
Well, that would be great to use some of that budget to crack down on these corporations. For Americans under the age of 65, the government pays over $300 billion per year to subsidize high private insurance premiums, while close to 1 in 5 medical claims are denied by these insurance plans. These denials cause immense suffering, like they did for Lila, a 10-year-old child who had to hold bake sales to pay for care for her chronic pain condition after United Health denied her claims. Does HHS intend to use the funding that you've set aside, this $2.5 billion in funding, for oversight to investigate wrongful denials of care by private insurance companies?
I would love nothing more than to have those dollars available to do that, and I hope that you and your colleagues are successful in getting that money across the finish line in the budget.
If we get it across, we're going to do everything we can to get it across. I just hope you use it to investigate some of the profiteering practices of these private insurance companies. Researchers reported that hospital emergency rooms participate in the highest price gouging in areas that serve patients of color and uninsured patients. Since many lawfully present immigrants are initially barred from accessing public health benefits like Medicaid and CHIP, they're more likely to be uninsured and become the victims of price gouging by hospitals. I know, Secretary Basara, that you as a lawmaker worked on removing this bar. As Secretary of Health, would you be willing to work with me on my bill to support removing this arbitrary barrier to public health benefits?
As we move toward universal coverage, that's one of the elements that has to be in place. I look forward to working with you as to finally get there if we can.
Thank you so much, Mr. Secretary.
Thank you.
I yield back, Mr. Chairman.
Thank you. The gentleman from Wisconsin, Mr. Brothman.
Yeah, I'll go over a few of the programs. Do you have a new payment model for physicians who implement anti-racism in their care plans?
I'm sorry, Congressman, if you...
Do you have a new payment model for physicians who implement anti-racism in their care plans? Are you familiar with such a thing?
You'll have to give me more details so I can understand what your question relates to.
Okay, do you have an Office of Climate Change and Health Equity?
Yes, we do.
Could you explain what that means?
If you walked into many of the communities throughout our country, they are suffering ill health, many times driven by the fact that the climate has exacerbated conditions. You have communities that no longer have clean drinking water running through their taps because of the drought that has occurred, because of the climate change that is occurring in this country. You have people who are suffering conditions where they can't afford to pay for their heat because the conditions have gotten so cold. Climate has affected everything, including our health. We have an office that tries to make sure that we protect people's health, and one of the ways we can do that is to also take into account the effects of climate change.
Sometimes it's too cold and sometimes it's too hot.
Congressman, people are dying.
You said you had problems in communities that sometimes...
People are dying.
You said sometimes you have problems in communities because the communities are too cold?
Correct. People are dying in some of these communities because they don't have access to clean drinking water. People are dying because they can't afford to keep the heat on in their apartment. People are dying, and so we don't want people to die. That's a bad health condition if you die. We want to make sure we do everything to address it, including the effects of climate.
Could you explain what health equity means?
Health equity, fairness and inclusion. We found out through COVID especially how we have gaps in our system where there are communities that are left out completely, individuals falling into black holes when it comes to care. We're going to do everything we can.
I don't understand what you mean by left out.
Congressman, do you walk through your communities? Do you walk into your district and find people who don't have health coverage? Do you find people who can't afford the food they need?
I think everywhere, people go to the hospital. Sometimes the hospitals complain because they've got to take care of people and aren't getting reimbursed. So we have very generous local Medicaid programs for people who want to sign up for them.
I'm sure you have poverty in your district, Congressman. Have you walked your district?
Well, sure. We know people who are poor in my district.
Then you should understand what it means to have health equity so that those folks aren't left behind.
Well, right now in Wisconsin, I believe everywhere around the country, we have a Medicaid program for people who are, I guess, what you describe as poor. Frequently,
we still have some 25 to 30 million people who do not have access to insurance, health insurance, who have to use the emergency room often to get their care. Often by then it's too late.
Now we'll say you have there's a new guidance from the Food and Drug Administration and the Centers for Disease Control that prompts healthcare systems to prioritize COVID-19 treatments, such as monoclonal antibodies, based on individuals' race. Is that true?
Based on their race?
Correct.
Can you show me what you're reading from? I'm not aware of anything where we prioritize based solely on race.
Maybe solely, not even partly?
We prioritize based where the need is.
Okay. Okay. Okay, we'll leave it at that.
Thank you, Congressman.
Good. The gentleman yields back. Gentleman yields back. The gentlelady from Pennsylvania, Ms. Wild.
Thank you, Mr. Chairman. Good morning, Secretary Basara. Good to see you again.
Yes.
Nice to see you yesterday. I want to use my time today to talk about a pressing issue, the mental health of our hardworking first responders. As you well know, law enforcement officers die by suicide at a greater rate than the general population, and we must do more to support them. I'm proud to say I took action and secured millions of dollars in funding in the American Rescue Plan to support the mental health of our public safety officers. Under your leadership at the Department of HHS, the funding I secured has been awarded in grants to entities in Georgia, Colorado, and in my home state of Pennsylvania, and is now working and getting results. I know this funding is working to develop and implement training, tools, and resources designed to reduce and prevent burnout, depression, anxiety, suicidal thoughts and actions, and substance misuse. But could you please share more about how this funding is having an impact?
First, I have to begin, Congresswoman, by applauding you for the work that you've done on this issue. Having served as the Attorney General, therefore the Chief Law Enforcement Officer of the largest state with the largest law enforcement force in the nation, I can tell you how many of our men and women are suffering true stress. Every year, we would have a ceremony to acknowledge the fallen officers in California. I can't tell you what men and women go through, and it is more than appreciated what you're doing to try to help folks who are in public service protecting us day in and day out. We're going to work with you on your legislation. Thank you for your support of the Learn to Brain Act, which made it possible for us to provide first responders with more services, access to care. And I hope what you'll continue to do is work on trying to remove the stigma that occurs when a law enforcement officer has to seek out mental health services. Oftentimes I've been told, better not to do it because don't want that on my record. I want to be able to get promoted, and I don't want anyone to think that I'm suffering from some kind of mental stress, because that might endanger my chance to go get promoted. So we have a lot of work to do. Men and women, I mean, things have gotten very complicated when criminals are better equipped with weapons than our law enforcement officers. There is real stress, and I thank you for what you're doing, because it's an untold story of how much stress some of our first responders and law enforcement are going through.
Well, thank you, Mr. Secretary. I look forward to working with you on this as we go forward. Are there other things that you are aware of that we can specifically support using the ARP funding or supplemental funding to make sure that we are supporting our first responders?
Well, above and beyond providing this resources for further training and access to support, trying to make sure that the privacy of officers is protected when they do seek mental health services, I think it would be important to continue the trend in some communities where first responders, especially, for example, are homeless, doesn't always mean the 911 call goes to the local police department. So this way, if it is going to be someone in a uniform, law enforcement uniform, they have someone who's prepared as a mental health professional, as a substance use health professional, or as a social service health professional, so that the response is addressing the actual need of the person that's on the streets and for the reason the 911 call was made. I think that would help our law enforcement officers tremendously. There are some law enforcement agencies that actually now have some of these professionals right along with their officers to be able to do the response the best way possible. But the more we keep our officers focused on what they were trained to do, protect and serve, the less we're going to have situations where not only is the individual who was the subject of the 911 call, but the officer become victims of what could end up being a bad circumstance.
Thank you for that very thoughtful answer. In the 116th Congress, I co-introduced just such a bill with Representative Beasley of Illinois. And you know, sometimes my colleagues on the other side of the aisle have derided this notion of people with mental health training accompanying police officers. But what I have heard from police officers in my district is that it would be welcome. We are not looking to supplant the role of law enforcement officers. We are simply working to assist them with that type of legislation. Thank you very much, Secretary Basara, and I look forward to working with you. And I yield back, Mr. Comer.
Thank you for your work.
You know where Comer is. He's in committee himself.
Thank you. The gentleman from Idaho, Mr. Fulcher.
Thank you, Mr. Chairman, and Mr. Secretary for being here. You know, one of the gaps that we have in our healthcare coverage is for people who may be changing jobs or in temporary employment or starting a new job, waiting for health insurance, also for people who may not qualify for an ACA subsidy. Now, in my home state of Idaho, we've been a leader in offering the Affordable Care Act compliant short-term health plans, also known as enhanced short-term plans or ESTPs. And these plans provide the same essential benefits as a typical ACA plan, but at a more competitive price. And they provide the same or similar pre-existing condition coverage as an ACA plan, other medical issues during the period, not requiring a qualifying life event to occur. They have a renewal guarantee of up to 36 months, and they're very, very popular, and they've shown significant savings. And so with that, my question to you is, will you commit to ensuring that these plans can continue moving forward to help get people the access to affordable insurance they need?
Congressman, thank you for the question, but I'm not sure I can agree with everything you said, because a short-term plan should be short-term. Under the ACA, each plan insurers are now supposed to provide certain benefits to all people who apply for their plans. These short duration plans are meant to tide people over until they can get into a more permanent plan. Because they're short term, they're allowed to evade some of the requirements in the law when it comes to benefits. If these plans provided every essential benefit that an Affordable Care Act plan provided, they wouldn't have to be short term. They could be long term.
Mr. Secretary, if I may.
I'm sorry?
If I may, Mr. Secretary, if you happen to fall in that category, and you have temporary employment or you're changing jobs, you may not qualify for that subsidy, then your definition of temporary may be just a little bit different at that point.
Okay, Congressman, I caught most of what you said, but remember, if you're a temporary worker or if you're trying to get access to a plan, it should not be a short-term plan that is not meant to be a permanent fixture for you. It's to tide you over. But some of these plans have been extended.
These are not permanent fixtures. There is an extension period that goes up to 36 months. They're not permanent fixtures. And that's why I'm asking, will you commit to maintaining the flexibilities that have been allowed so far?
We will do everything we can to make sure there's flexibility for folks who need a short-term fix, but to have these plans extended in ways, because again, these plans don't offer all the benefits to individuals that they're supposed to under the law. We want to keep that as a short duration so they can get into a truly robust plan that provides them all the benefits and coverage they need.
And I do ask you to take a closer look at that. I think you'll find that those essential benefits are indeed covered. We just need to continue to maintain that flexibility. They're serving a purpose, and please take a closer look at that. Going to shift gears before my time is out. On October 4th of 21, HHS issued a final rule that reversed the previous administration's rule preventing Title X family planning funding to flow to organizations that provide elective abortions. Now, this directly conflicts with the underlying Title X statute, 42 U.S.C. 300A6, and I'm concerned, Mr. Secretary, over the administration's removal of the financial and physical separation requirements of the previous rule, which thereby allows co-location of abortion providers in the same healthcare setting, and that means that Title X money can indeed flow to abortions. Please explain your reasoning on that and for allowing the barrier to be broken giving that that allowance to use taxpayer funding for abortions?
Thank you, Congressman, for the chance to respond. I think the answer is actually very clear. Title X provides family planning funding. If you provide family planning services, you're entitled to apply for family planning funding. If restricting an organization that provides family planning services simply because they provide a particular service that you or someone else may not like, and I say you generically, Congress may not like, doesn't give us a reason to exclude them from access to the funding for the family planning services which they offer. We're simply making sure that if you offer family planning services, you can qualify to receive some of the funding to offer those family planning services, period.
Thank you, Mr. Secretary. And I am out of time, and so I'll just close with this. Please understand that that is in conflict with the current statute, and I encourage you to look at that. Thank you, Mr. Secretary.
Thank you.
Back.
Thank you. Gentleman from California, Mr. Tisanier.
Thank you, Mr. Chairman. Thank you, Ranking Member. It's always a pleasure to see you both. And of course, Mr. Secretary, a great California. Nice to see you.
Great to see you, Congressman.
Always a pleasure. I want to ask you a question on two issues that I've spent a lot of time on another committee, in the Oversight Committee, both with former Chair Cummings and now with the current chair, on the cost of prescription drugs first, and then on opioids. So on prescription drugs, as a survivor of leukemia, the drug that keeps me alive for the last 7 years, since I was diagnosed with stage 4, much of the research has come from taxpayer-funded research, starting in World War I in the Department of Defense, and then through NIH and the American Cancer Institute. So one of the things would be nice to know as we have hearings with the private sector is we want to have them invest in research. But it would be nice for members of Congress and the public to be able to distinguish the taxpayer-based funding that went into, for instance, my medication that cost somewhere from $300 to $500 since I started taking it for an American, but for an Australian it costs $37. So clearly in a global marketplace, we've had the CEO of pharmaceutical companies come to oversight. It would be really helpful, I think, for Congress and the American public to be able to understand, not perfectly, but at least a little bit, in terms of an assessment of where the base investments for these drugs came from and how you can induce private sector investment so that the public and private sector investment is understood fully and is maximized so more people like myself can get life-extending drugs with both private and public investment. My research shows that most of the basic research that got the private investment started at NIH. Could you respond? And can you help us distinguish?
First, I have to respond by saying it is a real pleasure to see you looking so robust and active.
You're a long way away.
I take joy. I take joy,
Thank you,
Congressman, in seeing you because I know how much of a fighter you are, not just on this issue of fair and reasonably priced drugs, but just a fighter in general. And you should be on a billboard. We should take you around. You're the best marketing tool we have for the cancer moonshot. And so I will say to you, you also make a tremendously important point, and that is, why is it that Americans have to pay manifold times more for the same drug that someone else in another part of the world is paying so much less? And in fact, those drugs, as you mentioned, are actually invented, manufactured sometimes here in the U.S. That's why the president is so intent on trying to get drug prices down by making sure we have the tools to do it. And that would include negotiating the prices, having more transparency. What you're touching on is the issue of transparency. Why can't we know better what it really costs and who actually funded that particular medicine? And so I want you to be around vigorous for a long time because I may need you to accompany me as we go around the country trying to make the case for better drug prices for Americans by giving us a chance to have the tools that the president wants to negotiate better prices and have real transparency in drug pricing.
Well, I'd like to pursue it, Mr. Secretary, because I think it's really important for us to understand how we get these life-saving drugs so that we can incentivize and continue to get them. On opioids, we've had the Sackler family come and testify, the Oversight Committee. Still a lot of problems. Department of Justice has to hold them accountable, in my view, and of course the states are doing a remarkable job. In your previous job, we've talked about this. So what are we doing to get this right? We still want Americans to get the proper medication, but we want to have that assessed properly? Your department's doing work around this. How is that going, and how can we help you?
First, I have to applaud my former colleagues, the state attorneys general, who really pushed forward this case to hold accountable some of the manufacturers, the distributors of opioids, and that was a truly bipartisan effort on the part of those state AGs, and I think they deserve a great deal of credit for getting tens of billions of dollars back into communities to help address the ills of opioids. We can continue working with our state leaders, the AGs or governors. We are going to put major resources into our new drug abuse strategy, so that we get away from stigmatizing individuals and we try to get them towards harm. And what we're going to try to do is make sure that we can get across some elements of the Build Back Better proposal the president had, because if you all can get that through, we'll have the kind of resources we haven't had in a long time to try to help Americans stay alive.
Thank you, Mr. Secretary. My time's up. If I'm on a billboard, I want to be on there with the ranking member in the chair.
Amen.
Thank you. The gentleman from Pennsylvania, Mr. Keller.
Thank you, Mr. Chairman, and I would like to thank the Secretary also for being here today. Wanted to talk a little bit about community pharmacies, healthcare providers, and we talk about that, to the patients using Medicare Plan D or Part D plan. Price transparency is an essential issue for Americans, particularly people that I represent in central and northeastern Pennsylvania. As has been the case for too long, pharmacy benefit managers, or PBMs, play a significant role in the drug pricing debate, with certain anti-competitive tactics that increase patient costs at the pharmacy counter and claw back hundreds of thousands in DIR fees from pharmacies months after drugs have been dispensed, making it difficult to operate the small businesses and making it more difficult for providers to deliver health care. CMS has determined there was, and I found this hard to believe, a 91,500% increase in DIR fees between 2010 and 2019. I think we could all agree that that's pretty much unacceptable growth in these fees. And it creates access issues for many seniors in Part D and increases the possibility of pharmacy deserts across Pennsylvania and the United States. CMS also anticipates that the average growth of pharmacy DIR fees will increase roughly an additional 10% per year. By taking action, we can help save America's seniors up to $9 billion in out-of-pocket costs. So, Mr. Secretary, since you were before the committee last summer, CMS has issued its calendar 2023 Medicare Advantage and Part D proposal rule, which includes, among other things, inclusion of pharmacy price concessions in a definition of a negotiated price and clarification on the definition of price concessions. These stand to increase transparency for seniors and community pharmacy providers, but more work can be done to close loopholes and reduce unintended consequences. We've heard from many self-insured employers frustrated with the lack of transparency in the pharmaceutical supply chain. Specifically, only 3 PBMs control 3/4 of the market, limiting competition and innovation in the sector. Notably, these 3 PBMs also own or are owned by health insurance companies. Additionally, the PBM business model could create incentives for PBMs to prefer higher list price, higher rebate drugs, which would increase drug spending for employers and their employees. So like all that background, I think we agree on pretty much all of that. What would be our plans to address what PBMs have been doing in having less transparency? How do we make them, and what would our plan be to make them more transparent for employers and consumers?
Congressman, thank you for describing the situation, because I don't think most Americans understand how their drugs are priced and why. You've explained one aspect of it, which is critical, and that's why CMS, as you mentioned, has put forward a rule that would change the way these PBMs price their products, so that we're actually going towards the lowest price that's been negotiated versus letting them inflate the price. We're right now in the process of reviewing all the comments that have been received during the comment period for that rule. We hope to be able to move something soon. But as you can see from our rule, we're trying to make sure that we drive the price at the point of sale that the individual, the patient, feels down to what it really should be based on what was negotiated. And so we look forward to working with you because we have no doubt that folks are going to try to squirm through and find another, escape valve to do something more than provide the best price possible.
Yeah, and I think transparency leads to better quality.
Absolutely.
It leads to a more affordable price. That competition, I mean, to me, that's I embrace that because I think it's beneficial to everybody concerned if we have, and I think we agree on this.
I concur.
The more transparency, I mean, I don't have a problem, we're in America, I don't have a problem with people making money. The problem is it should be transparent, and that transparency drives higher quality and better customer service and better pricing.
Sunshine is the best disinfectant.
Yes. Thank you, and I yield back.
Thank you. Gentlelady from Connecticut, Ms. Hayes.
Good morning, Secretary Basara.
Good morning.
Thank you for being here. Before I get to my questions, there's something I just wanted to elevate for you. It's not often that I have the undivided attention of a secretary, so I want to share something that I read. The Trevor Project released the results of their national survey, and it said 52% of all transgender and non-binary young people seriously contemplated killing themselves in 2020. More than half thought it would be better to be dead than trying to live with the rejection, isolation, loneliness, bullying, and being targeted by politicians and activists pushing anti-trans legislation. You said many times today in this hearing that your job is to follow the law and enforce it. I appreciate your statement reaffirming your commitment to support for LGBTQI+ children and youth and their protection. So what I ask you is, in your authority as secretary, please protect these children. They are somebody's children. They are our children. That's not my question, but I just wanted to make sure I said that to you because as a high school teacher, I have had many kids come to my class before school, after school, to have conversations that they couldn't have with anyone else, who were scared and lonely and felt abandoned by the adults around them. And I just fear the direction that we're going, and just know that it is more important now than ever to do our job to protect these children. In my state of Connecticut, nearly 1,300 people died last year from overdose. That number is about 106,000 around the country. The opioid crisis remains a major problem in my district, particularly when it comes to access to care. On the same note, I saw so many families struggle with identifying that there was an issue with substance abuse, but desperate to find care or high-quality care or something that they could afford. Many of these young people went on a 3-day hold in the emergency room and went right back home with no additional help or support. The fiscal year 2023 budget provides significant investments in mental health, behavioral health, and substance abuse services. Can you share how these investments will translate into access to care for my constituents, particularly young people?
Congresswoman, thank you. First, thank you for your comments earlier. Amen is all I can say to what you just said earlier in terms of protecting every American. In terms of what we're doing, we changed our strategy on drug use. Two of our elements that we included that we all want to do prevention, keep people off drugs. We all want to do treatment to get them moving forward. But we've included two new elements to this as priorities. Harm reduction, because it's not just a matter of treating, it's keeping you from harming yourself long term. And the additional item we put into this new strategy is follow-up care. So we don't, as I said earlier, we don't want to just be like FedEx. We don't want to drop off the drugs to help you get better at the door and then, get out of town. We want to be there to follow you through to make sure you, in that life course, we get you in the direction you want. And so we are going to use those resources to go there, and we're going to really focus on kids. We're going to make an emphasis on foster youth because we know the troubles that they all face. So we're there, and we look forward to working with you.
I'm very happy to hear you say that because, as we all know, we are learning addiction is a disease. And for years after the rehabilitative services, people are still struggling. So the harm reduction, the wraparound services, the long-term care is incredibly important. The budget provides an additional $30 million to support the development of opioid overdose reversal treatments and improve prevention services. What else can we do to provide community health providers with sufficient resources to prevent deadly overdoses and expand access to high-quality substance abuse disorder treatments?
I know you know this one. Provide support to the workforce. We don't pay them enough. They do yeoman's work. Many of them are former addicts. If we could let them know that we appreciate and elevate what they do, give them esteem, we could get more people working in this area. So if we could help the workforce, and they are committed because many of them are former drug users, if we could let them know that we appreciate what they're doing to save a life, I guarantee you, you would find a lot of people would turn their life around.
You're absolutely right. I know that. I just wanted to hear you say it on the record. We actually just helped a constituent in my district with a very similar issue to connect with our workforce development programs and get training to go out into the community as a former abuser to now help out on the other side. Mr. Chair, I yield back. Thank you for being here today.
Thank you.
Thank you. The gentlelady from New York, Ms. Stefanik.
Thank you, Mr. Chairman. Mr. Secretary, I wanted to raise what I'm hearing from thousands of constituents who are very concerned about the mandate requiring masks for young children and toddlers in Head Start programs. We know, based upon recent studies, that masks on young children cause limited vocabularies, delayed speech development, and difficulties with social interaction and confidence. In addition, we know that face masks disrupt holistic processing and face perception in school-aged children. Even the World Health Organization states, quote, children aged 5 years and under do not need to wear masks. Children of this age should not wear masks for a long duration. We know on the ground from constituents that this rule is still in place. The CDC revised its guidance on February 25th, indicating that masks are no longer necessary in the vast majority of this country. Why is your agency still imposing this harmful mask mandate on toddlers and young children in the Head Start program?
Congresswoman, thank you for the question, because obviously we're still within this pandemic and it's a very salient question. What I would say to you is that we know that masks are safe and they are effective. We know that many of our children, especially those that are under the age of 5, can still not receive a vaccine, and so therefore they are in danger of contracting COVID. Hundreds of families across this country would tell you about how COVID does hit those under the age of 5 because they have lost their child to COVID. And so we're going to do everything we can to make sure those children are protected. When you have something that's safe and effective like masks, they should be used. And we obviously understand that the science is guiding us on the actual implementation of those policies. But I will tell you that there's no contradiction in the fact that that masks have proven an effective way to help control COVID.
So the position of you, Mr. Secretary, and the position of President Joe Biden is to require masks on children under the age of 5, which science in fact proves the masks hurt children, both in the development, whether it's intellectual development, speech development. That is the position of President Joe Biden.
Congressman, as you know, many Head Start programs—
It's a yes or no question. Is that the position of President Joe Biden? You are the cabinet secretary, so the position of this White House, this administration, is to require masks only at this point for children in the Head Start program. There's no requirement for masks at K through 12 across this country. So now we're in a position where the only mask requirements, and we know that science shows that those least impacted by the COVID pandemic are the youngest of young children.
Congressman, the policies that the President has espoused and that we implement are to make sure everyone is safe and effective using the most proven methods possible, and that's what we will do. Head Start, we are reviewing the policies as we speak, but we will make sure that we're protecting every child in America under a Head Start program, since Head Start is funded primarily through federal dollars.
Through taxpayer dollars. Taxpayers who do not support this mask mandate on children in Head Start, on our youngest of young children, who the mask mandate is hurting the most. So my question to you is specifically, what scientific studies are you relying upon? Are you saying that the HHS position is different than the CDC guidance? Who are the experts in HHS that are circumventing and coming over the top of the CDC recommendations?
Congresswoman, I can only show you the evidence that we have, the studies that have been done, the accumulating evidence that we've seen that show that a child wearing a mask is safe.
Who are the studies conducted by? Who are the studies conducted by? And do you believe the HHS has the authority to make a different decision than CDC, different recommendation than CDC?
Congresswoman, I'm more than welcome to share with you the studies that have proven that wearing a mask, if you're a child, helps, it's safe, and it's effective. We are looking at studies that have looked at children at the age of 2 years, and we've been able to show that, in fact, making sure that Americans use masks.
What do you say to the studies about the speech delay? What do you say to the studies about how, in fact, the transmission rates and the negative effects of COVID is the lowest of the low when you're talking about children under the age of 5? What do you say to those studies?
Congresswoman, the accumulating evidence on child mask wearing is showing that it does not impact their language or emotional development.
It shows that it doesn't work. This is by World Health
we each can have our opinion.
CDC.
Congresswoman, you're
Mr.
entitled to your
Secretary,
opinion.
you are wrong in this position, and if it is the position of Joe Biden to require mask mandates only on children under the age of 5, that is woefully out of touch with the American people. It's also woefully out of touch of health experts across this country. I'm glad you clarified that it is this president and your agency that is circumventing the best scientific and medical advice to impose these harmful mask mandates. I yield back.
Thank you. The gentlelady from Georgia, Ms. Macbeth.
Thank you so much, Chairman. Thank you for convening this hearing, and thank you, Secretary Basara, for your continued service to our country. We truly do appreciate your service. And as you know, during the public health pandemic, we've seen the rising rates of substance use and overdose, gun violence, and domestic violence. With many families that have been sheltering at home, victims of domestic and family violence have become even more vulnerable. And I've seen too many families in my home state of Georgia suffer at the hands of domestic and family violence. We really have to make sure that we're doing everything that we can to protect these families and families all across the nation. But it's now time more than ever to secure additional investments in protecting these survivors and protecting their children. The pandemic has compounded the challenges that people surviving intimate partner violence face every single day, even as we continue our path toward a full recovery. To protect survivors of domestic and family violence, the House passed my legislation, the Family Violence Protection and Services Improvement Act. We'll call it FVPSA, to reauthorize and improve the Family Violence Prevention and Services Act programs. This budget actually includes over $500 million for FVPSA funded and also FVPSA programs. Building on the American Rescue Plan Acts, it was about $450 million in emergency supplemental funding to support survivors of intimate partner violence. Secretary Basara, how would this additional new investment really work to strengthen the department's efforts to distribute this critical funding? And how will this budget support broader HHS efforts to help people that are disproportionately impacted by intimate partner violence and help them to recover?
Congresswoman, first, thank you for your leadership in this area. I don't think anyone will challenge the assertion that COVID caused many problems. One of them was at home, where we saw the increase in violence, domestic violence, intimate partner violence, which was a travesty because here you're trying to stay safe by not going out, and what you find is that you ended up with worse circumstances. And so thank you for the work that you've done on this issue. The funding that you mentioned is more than double what it was in the previous year. We hope that Congress, you and your colleagues will find it fit to provide that additional funding. We want to be able to increase the funding and the support for those individuals who are the victims of that domestic violence, but we also want to fund very essential things like the hotline that people can call when they're in real need, urgent need of safety and care. We want to make sure that that hotline is available and that there will be someone available to answer that call when you're in your moments of most need. And so we will continue to work with you as we try to not only get the funding through, but also the reauthorization of FVPSA in the future. But again, miles and miles of thanks for what you've done in this space.
Well, thank you so much. And as we approach Black Maternal Health Week and Mother's Day, which is coming up in May, this budget invests actually $13.5 $3 billion to support new initiatives to reduce maternal mortality and disparities in maternal health outcomes through what we know is evidence-based interventions. How will this help, how will this funding really work to help strengthen the department's existing efforts to improve maternal health policy and equity?
Well, again, thank you for the support that you and others have lent to the Momnibus legislation to try to get things across the finish line for so many of our families in need. With the budget that we have through the omnibus, and if you all pass Build Back Better, even more will be done. But what we're going to try to do is continue our efforts to try to help deal with, for example, maternal mortality and morbidity, which is in outrageous levels in this country, because in some parts of our country, not everywhere, but in certain communities, especially, for example, in the Black community, Native American community, you see high rates of death of mothers who recently delivered. You see the inability for some families to be able to cope with the stress that comes with becoming a new family. And so we have put a proposal out there, which some states are now beginning to accept, which allows Medicaid to provide not just 60 days of maternal health care postpartum, but a full year of coverage. We think that'll go a long way in helping a lot of families. We also have specific programs that are targeted to help women in areas of disadvantage, so we can make sure that we're providing them with the help they need to prepare. My wife, who's an OBGYN, will tell you that many of these issues can be resolved before the delivery if we just give access to services. So we look forward to working with you to strengthen not just your legislation, but the efforts to help women as they get ready to deliver.
Well, thank you, Mr. Secretary, for your work, and I yield back the balance of my time.
Thank you. The gentlelady from Iowa, Ms. Miller Meeks.
Thank you, Mr. Chair, and thank you, Secretary Basara, for being here. I'm just going to start this by saying that I'm a physician and also former director of the Iowa Department of Public Health. In part because of the Biden administration's deference to the teachers' unions, the CDC's school reopening guidance suggested a far greater risk to reopening schools than actually existed. As a result, many students stayed at home far longer than they should have. 1 year later, the devastating impact of the Biden administration's unwillingness to challenge its political allies is clear. And let me state that in Iowa, our schools opened to in-person learning in August of 2020. And in Nevada, as I've talked about in this committee room before, Nevada reopened its schools at the top of 2021 because between March 16th of 2020 and June 30th of 2020, 6 students committed suicide, and between July 1st of 2020 and December 31st of 2020, an additional 12 students committed suicide, the youngest of whom was 9 years old. So we know that the policy of keeping schools closed not only was detrimental to learning, detrimental to child poverty, to nutrition, to reporting of child abuse, but it was also detrimental to the lives of these children with the lack of interaction with other students and with their teachers. Just last week, the CDC released a survey data showing increased rates of poor mental health, substance use, emotional abuse at home during the pandemic. Learning loss has also been dramatic, as I said, and the World Health Organization anticipates that childhood poverty will have increased by 15% and will take decades to recover. A National Bureau of Economic Research report late last year found that remote learning contributed to highly significant learning loss with much less pronounced drop in scores among students who continued to attend school in person. Secretary Basara, looking back on the last year, do you wish your agency would have shown more courage in standing up for children who desperately needed to be in school?
Congressman, first, some of the statistics you mentioned are just devastating to see when children die, and we've been talking a little bit about the stress that families are feeling, so thank you for pointing that out. I will tell you that whether it's through the CDC or whether it's through the FDA, in moving forward on COVID, we've tried to do the best we can based on the science and the evidence. And in protecting children, we want to make sure that we use the best science and the evidence. And the CDC has consulted with numerous stakeholders, whether it's teachers, principals, whether it's education experts, whether it's those who have run departments of health or education before. What we do is use the best guidance we can from those experts and the evidence that's before us with the science to make the decisions. And I think as a result, today, virtually every child is back in school.
So you don't have any regrets that your agency and you did not show more courage in standing up for children. You mentioned the number of deaths that had occurred in children. So do you know how many children have died of COVID-19?
I know it's in the hundreds. I don't have the precise number because obviously it changes as the days go by.
And are you aware that the CDC revised downward the number of deaths that have occurred in children from COVID-19?
The CD is constantly trying to make sure we use the most accurate information available, and so we should surprise no one that we're trying to make sure that the public has the best information possible.
So the American Academy of Pediatrics just published in March that 0.00% to 0.27% of all COVID-19 deaths in children. That's the percentage rate. And for that, we're willing to create masks in children in the Head Start program or other programs that we know lead to learning loss, lead to loss of communication, lead to detriment in their learning in order for what scientific guidance?
Congresswoman, I have 3 daughters. I want to make sure I get to see my 3 daughters and they get to see their father pass away instead of me seeing one of my daughters pass. We will do everything possible to make sure no parent sees their child die.
0.00% to 0.02% of all COVID in children has resulted in death. But yet the learning loss is significant. It is permanent. I have children. I care for my children. I am vaccinated. I have given vaccines. The risk for children to transmit COVID-19 because of their immune system is extraordinarily low. Who exactly are we protecting? When we had programs that would mandate that teachers went to the top of the line, as it should be, so that they would reopen schools, but to continue a policy in children that's detrimental to their speech, to their learning, to their ability to progress in this country in the most critical years of their lifetime is a policy that should not be imposed upon our children. Thank you, Mr. Chair. I yield back my time.
Thank you. The gentlelady from North Carolina, Ms. Manning.
Thank you, Mr. Chairman, and thank you, Secretary Basara, for being with us today. Like millions of American families, my family has felt the impact of high prescription drug prices, and even with health insurance, patients with chronic illnesses like my daughter must navigate burdensome policies like step therapy and exorbitant bills that saddle them with outrageous out-of-pocket costs for treatments they need to be healthy. I'm pleased to see President Biden's commitment to lowering drug prices and capping costs for Americans. Can you expand on the steps that HHS will take in the coming fiscal year to ensure that price does not remain a barrier to patients' timely access to essential medication?
Congresswoman Manning, first, thank you for not just your interest, but your work, your leadership on this issue. I will tell you that the President is committed to making sure we reduce the cost of prescription medication. There's nothing that can save Americans more immediately money and also save lives than giving them access to affordable drugs. And so we're going to continue to do everything we can in this space. We obviously look forward to working with you and your colleagues to give us the real authority to do the things that will really lower the cost of prescription medication. But if Congress doesn't quite get there, we'll use whatever authorities we currently have to try to make sure that we seek more price transparency from the drug industry, and we will do everything we can to make the industry more competitive so we drop the prices as much as we can. But it sure would go a long way if Congress would help us have the ability to negotiate drug prices, for example, and to be able to seek more transparency in the way drugs are priced and marketed.
Thank you. We will continue to work on this issue because it is critically important to so many Americans. Let me move on to a different issue. The health and financial challenges of COVID-19 and the American Rescue Plan. We know that a record 14.5 million Americans now have marketplace coverage. However, states like mine, North Carolina, and 11 other states have still refused to expand Medicaid to ensure that hardworking Americans have access to insurance coverage. And this coverage gap exacerbates racial and ethnic disparities in health outcomes. What steps does the Biden administration plan to take to help close that coverage gap and reduce these inequities?
Congresswoman, thank you. As you're aware, because of your state, there are some 4 million Americans who today could have health care insurance coverage through Medicaid, but don't because of the political decisions being made at the state capitals of some 12 states. And it's unfortunate because those 4 million people suffer as a consequence of that politics. We're going to do everything we can to try to reach those people, but it's difficult because we're limited in our authorities. That's why I hope Congress is able to pass legislation through Build Back Better or whatever means you find that help close that Medicaid coverage gap. We know that there are proposals right now sitting before you. We hope they're able to get there because there is no reason why, when the law permits it, politics should prohibit it. And we think it's important that all those people get covered.
Thank you. Another area that the pandemic has shown a light on is the problem we have with maternal mortality and the access that women have to the health care they need for prenatal health, for contraception, and for a wide variety of other healthcare needs. I was pleased to see that the White House budget proposal requests a historic $400 million for the Title X Family Planning Program. Overall, how does this budget support federal efforts to address issues regarding access to high-quality maternal and reproductive care?
We're going to work as much as we can. We're dedicating $474 million to reduce maternal mortality and morbidity. You mentioned the Family Planning Services funding. We're going to do everything we can to make it clear that we want to make sure that when there's going to be a baby coming into this world, both mama and baby are in good health.
Thank you. My other colleagues have talked about the critical issues we've seen arise with mental health problems. I know my time is already almost expired, but let me just encourage you to do whatever you can to help us address this crisis of mental health problems in adults and also in our students. And I yield back the remainder of my time.
Thank you.
Thank you. Next, we'll have my distinguished colleague from Virginia, Mr. Good.
Thank you, Mr. Chairman. Thank you, Secretary Basara, for being here with us again. Mr. Secretary, this administration's policies ensure that everything is about the border. Everything is about the border, especially with the termination of Title 42, not to mention, of course, ending MPP, the Remain in Mexico policy, not to mention ramping up catch and release, stopping the border wall, promoting amnesty, refusing to implement E-Verify. Essentially, we've opened the border and we've surrendered operational control to the crime cartels. One would think that the HHS Secretary would be particularly concerned about the 100,000 overdoses last year in our country, the leading cause of death for those ages 18 to 45 a year ago, and the administration's facilitation, purposeful facilitation, quite frankly, through the policies of the increased bringing into our country illegal drugs, fentanyl, other highly dangerous drugs, and so forth that are streaming across our border in record numbers. You would also think the HHS Secretary would be especially concerned about the health threat posed by the cancellation or the termination of Title 42. I'll come back to Title 42 in a moment. But rather than invest in border security, in light of all of this, 2 million illegal crossings a year ago, estimated to increase to maybe 5 million this year with the ending of Title 42. This budget cuts ICE funding by $150 million, and it prioritizes the so-called climate crisis. Do you honestly believe that the climate crisis is a greater threat to the health, safety, and security of Americans than the invasion of the southern border?
Congressman, thank you for the question. You tied together a lot of things, and so my response won't be as direct as you'd like. I'm saddened that
I'd like to know if you think that the climate crisis is a greater threat to the country and to the safety, health, and security of Americans than the invasion of the southern border.
The climate crisis is a true challenge for us. The challenges we face at the border, I wouldn't describe them as you would, but there is a challenge that we have at the border, and I think we have to make sure that we have the laws.
So you don't think the climate crisis is a greater threat than the invasion of the southern border?
I'm trying to answer the question.
I would like a yes or no answer. Do you think the climate crisis is a greater threat to the health, safety, and security of Americans than the invasion of the southern border? Or do you think the invasion of the southern border is a greater threat?
Well, if you could describe to me what you mean by the climate crisis and the invasion at the border, then I can give you a response.
So you would not say that the climate crisis is a greater threat?
The climate crisis is a great threat. Our border challenges are also great. And we have to tackle both, and you need to have a government.
What's disappointing on the border crisis is every effort and resource that's been directed there by this administration has been to facilitate more illegals crossing into our country, not to prevent it. Matter of fact, that's why they brought your department into it, is to try to help facilitate and accommodate those who are illegally invading and entering our country.
Let's go back to Title. For me to say that, I think it's nonsense what you just said.
Let's go back to Title 42. What led to Title 42 being terminated?
The law and the science.
What recommendations and advice did you provide during the decision-making process leading up to this reversal of Title 42? What advice and counsel did you give on that from a health standpoint?
To follow the law and the science.
So the science being that the pandemic's over and should be declared over, we no longer need these additional health precautions with Title 42?
No, Congressman, you're uninformed.
So we still have the same threat from the pandemic, so to speak, that we need to keep Title 42, or which is it? We're not going to turn people away because they're bringing COVID into the country under Title 42 anymore, but yet the pandemic is not over, or which is it?
Do you wish me to answer?
I'd like you to answer succinctly.
There is still a pandemic before us. It is not the same pandemic we faced before. The challenges we face are different based on the science and the facts. We make decisions on the pandemic.
How concerned are you that with the estimates that with the rescission of Title 42, that the 7,000 crossings a day acknowledged by Jay Johnson yesterday, I saw him interview Jay Johnson saying it's overwhelming, his words were, it's overwhelming our administration to have 7,000 a day. 1,000 a day is too many. We've got 7,000 a day. It's estimated this will take it to 18,000 a day. How concerned are you about that?
So I deal with the health issues, but I will tell you, having served in this
yes, what this is doing to our health services, our health care, the threat to the Americans from a health standpoint, from an education standpoint, from a social services standpoint, from a security standpoint, it's unbelievable this administration would rescind Title 42, and you would not counsel them not to rescind that.
Gentleman's time has expired. The gentleman from New York, Mr. Jones.
Thank you, Mr. Chairman. Secretary Basara, it's great to see you again. The President's budget request for fiscal year 2023 proposes critical investments in public health and it advances health equity. Notably, the budget includes new innovative programs to amplify HIV prevention efforts and further LGBTQ+ equity and justice. As you know, LGBTQ+ people, and especially queer people of color, face health disparities linked to social stigma, discrimination, and denial of their basic civil and human rights, including under federal law, considering we still have not passed the Equality Act due to Republican obstruction. Under President Biden's proposed budget, the Department of Health and Human Services will be using an equity-minded approach, making sure treatments and preventative services are available to the most vulnerable communities, including Black members of the LGBTQ+ community. Secretary Basara, I want to thank you for your commitment to strengthening the national HIV/AIDS strategy and working towards significantly reducing the number of new HIV infections in the United States by the year 2025. This proposed budget includes $9.8 billion in mandatory funding over 10 years to guarantee access to a drug known as pre-exposure prophylaxis, or PrEP, free of cost for all uninsured and underinsured individuals, and provide essential wraparound services like HIV testing. PrEP is 99% effective at preventing HIV infection. It is a life-changing, life-saving drug. It has been 10 years since the first FDA approval for this life-saving medication, yet there's still so much more work to do in making PrEP accessible for everyone who needs it. Access to PrEP has been inadequate and inequitable. While the rate of HIV infections among Black Americans is 8 times as high as among white Americans, just 9% of the Black Americans for whom PrEP is recommended have been prescribed this vital preventative medication, compared to 66% of comparable white Americans. This budget's historic investment in HIV prevention is critical to improving public health. And I've got two questions for you, Mr. Secretary. The first is this: what other HHS efforts are part of the Biden administration's larger HIV/AIDS prevention strategy? And the second question is, will the new proposal to make PrEP free of cost for all uninsured and underinsured persons extend to all FDA-approved forms of PrEP?
Congressman, first, great to see you again, whether it's in New York or here. It's great to see you. And thank you for your work in this space. President Biden made it very clear. We think if we really apply ourselves, we can eliminate HIV/AIDS as a threat to human life. And it's just a matter of putting our wheel to the grindstone. And so here we go. And the president has proposed, as you mentioned, a major investment over close to $10 billion over 10 years to try to really get us to the spot where we're offering services and the medicines that people need, in most cases free of charge and available to people, including in spaces where we often neglect communities. And if we do this, we think we can work with our partners that are locally on the ground already and providing some of those services, and we can make it happen. But it's going to take the effort that you and your colleagues can in pushing through this budget request so we can make those kinds of investments that people on the ground throughout this country are looking for.
Thank you for that, Mr. Secretary. In February, I sent a letter with Representative Richie Torres and 58 of our House colleagues urging CMS and the CDC to ensure that public and private insurance plans cover a new FDA-approved injectable form of PrEP known as Apretude at no cost to patients, just like the other forms of PrEP. As our letter describes, the research shows that this injectable form of PrEP is significantly more effective at stopping HIV infection than the pill form of PrEP. And recently, I was pleased to receive a response from the CDC that says, the CDC supports efforts to ensure no cost sharing extends to all PrEP medications approved by the FDA, including Apretude, and looks forward to continued collaboration with CMS to advance this effort. Mr. Secretary, I look forward to working with you on this effort moving forward, and thank you for your time today.
Thank you.
Thank you. The gentlelady from Michigan, Ms. McLean.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here today. I want to follow up, and I want to do it in a respectful way, but I need your help connecting the dots on the concepts for me. You'd said earlier that we want to protect our children. I think we all agree with that. You know, you'd made a comment that you want to make sure that that your children see you pass away first before you see your children. I mean, I think as a parent, and for all the parents in this room, I think that makes sense. I think what the American people are struggling with, especially, and I'll say I'm struggling with, is just the hypocrisy of you, your department, in this administration, and I say this in the most respectful of fashions. You had said as well, when Ms. Miller-Meeks asked you roughly how many children pass away, you said it was in the hundreds. And I'm in agreement, one child death is too many, right? But we put all of these restrictions on these young children, even though we know that there are other risks. No policy is perfect, right? My question is this then, why do you put your children in a car?
We make sure we put the seatbelts on them as well.
Right, and we have car seats, right?
50 years ago, we didn't have seatbelts.
Right, but even with that, even with the seatbelts, even with the car seats,
right? There are things we have to do, right? And
exactly.
We do all we can to protect them.
And as a parent, you make that choice, right? Because if you want to keep your child 100% safe from car accidents, you'd never put them in a car, right? If you wanted to keep your child 100% safe from COVID, you'd never let them go to school. But we don't. We as parents, and parents being the operative word, not the government, if I'm following your same logic, 608 children died under the age of 12 in 2019 from auto accidents, roughly hundreds. Yet we as parents have that, decision. you are taking away from the parents the decision of how to raise our children. So the concept to me doesn't make sense. If we're going to follow the parental science, my goodness, we leave it up to the parents to put their children in a car. Even with the seat belts, even with the car seats, just seems a little, a lot of hypocrisy to me. And I wonder really who we are trying to serve here. And I mean that in a respectful fashion.
And I appreciate the way you've asked the question. Let me give you, I hope, a respectful response. My 3 daughters were born very healthy. Some parents aren't so lucky. Sometimes you have a child who is immunocompromised. That child will associate with my child, who is very healthy. But if my child contracts COVID and may survive it, that child who is immunocompromised
and
may not.
I understand where you're coming from on that.
We have
but
responsibilities
no
for more than just our own child.
You're right. But then if you put your child, whether they're immunocompromised or not, in a car, you're relying on somebody else's safe driving habits. It's the same concept, sir.
Congresswoman, you're neglecting the fact that virtually every child in America today is back in school because we took precautions.
With masks. And I think you need to put the power, you need to give the parents the science. You need to let the parents parent, the teachers teach, and put the power back into the parents' hands, sir. So
as long as we all have to be responsible for each other.
Exactly. And with hundreds of deaths in COVID and hundreds of deaths of car accidents, I think the American people are only asking for the same consistent concept across all areas. And I think the frustrating part is the parents want to parent. Have a little faith in the parents. Have a little trust in the parents that they're going to do what is in the best interest of their children, not you, your agency, or this administration.
Or any member of Congress.
Exactly. I would agree. Put the power back in the parents' hands, and we have to look at risk to reward. Every time you put your child in a car, sir, you are exposing them to a drunk driver, an impaired driver, or a bad driver. But that's your choice to make.
And we take all the precautions that we can.
And let the parents do the same thing. Thank you, sir.
Thank you very much.
Thank you. The gentlelady from New Mexico, Ms. Ledger-Fernandez.
Thank you so much, Chairman Scott, for holding this hearing, and thank you, Secretary Basara. Good to see you again, and thank you for sitting here to answer our questions. You know, here in D.C., we're within 30 minutes of 7 hospitals and a lot of amazing providers, right? In my district, however, in New Mexico, which you know, my beautiful district, expectant moms from my hometown, Las Vegas, New Mexico, they have to drive an hour if they want to give birth with a doctor. In Gallup, on the Navajo Nation, 42,000 Native Americans will receive trauma care at the Gallup Indian Medical Center, which is the only trauma care center within a 150-mile radius. And this is what healthcare looks like in rural America. This is what healthcare looks like in rural New Mexico. And while we have a lot of amazing doctors and nurses, we simply don't have enough. And I really want to thank you and the administration for putting forth a budget that has mandatory funding for the IHS. I just came from a natural resources hearing. I am the chair of the Subcommittee on Indigenous People. We were honoring Dean Young, and this was a passion of his, and I am hoping that we will get this through with bipartisan support, recognizing this as indeed his legacy. But I want to talk about the general need for all of us in rural America. What is the IHHS doing to expand access to care in rural and tribal communities in the short and long term, especially coming out of COVID, which laid that devastating light on the number of deaths and devastation because there wasn't enough care?
Congresswoman, thank you for the question. And by the way, it really is a beautiful district that you have. One of my dearest friends, my roommate for 4 years in college, lives in Las Vegas. And if I can just really quickly mention, when we first met freshman year, he asked me where I was from, Sacramento, California. Well, I told him I'm sort of from a suburb of it, and then I asked him where he's from. He said, well, I'm from Mora. He said, well, I'm really not from Mora. I'm from a suburb of Mora called Ladue. And when I finally had a chance to see his home of Ladue, it was a cluster of a few homes, and it's what you have in New Mexico. It's a beautiful place. To your question, this budget is a groundbreaker when it comes to IHS funding in Indian country. We are asking you to move towards mandatory funding for healthcare services in IHS, something that's going to be for the first time available if you pass this, so that health centers in Indian country don't suffer the consequences of a breakdown in budgeting authority here, where you may have an impasse and not get monies across. If it's based on discretionary funding and you don't pass a budget, they get no money. All the other health centers do because it's mandatory funding. We also call for advance appropriations, which means they can project how much they'll have, so they can project what they'll be able to do.
So the IHS, I'm great on. I love the fact that you're doing that. I wanted to focus a bit on the rest of rural America with regards to getting providers there, getting them on the ground. And if you could answer that quickly, because I wanted to also talk about the Social Vulnerability Index.
We have a major focus on rural communities. Obviously, the Provider Relief Fund, we were able to drive additional dollars into rural health providers. We are going to continue to seek out more authorities for telehealth services, because so many members in the rural communities rely on telehealth today to receive their services. So we'll work with you to make sure we're getting good care, quality care to people in rural communities.
Well, thank you. And I want to also then turn to something else that affects rural communities, which is the Social Vulnerability Index, which, as you know, measures factors like poverty, car access, et cetera. The federal government has distributed COVID-19 resources, as I understand it, mostly by population to the states. But if the agency used instead the Social Vulnerability Index, vulnerable communities in rural Mexico and other parts of the country might get those medications especially quicker, and other resources. And I ask this because I know that you have an equity index, but maybe not a vulnerability index. And when there isn't enough nearby care, that's a problem. I was wondering if you could address that.
We have funds beyond those that are distributed by formula that let us target areas that are in real need. And that's how we're able to go into some of these communities above and beyond what would otherwise come based on a formula.
Well, thank you, Secretary. My time is up, but I will say I'd love to work with you because I am hearing that they're not getting the resources. So let's work together.
Look forward.
I yield back.
Thank you. A gentleman from Wisconsin, Mr. Fitzgerald.
Thank you, Mr. Chair. Thank you, Mr. Secretary, for being here. Mr. Secretary, during your time as AG of California, you sued the Trump administration over 100 times. Some of those lawsuits were attempting to stop the Trump administration's emergency declaration that would have, in my opinion, secured the border. There was a discussion earlier with Congresswoman Jayapal about Title 42, and in my opinion, and every border agent that I've spoken to, the repeal of Title 42 will make it worse. Do you agree with the President's decision to rescind Title 42?
Congressman, the decision was that of the director of the CDC based on the evidence that CDC has. The President follows the guidance of CDC. This is based on science and the facts on the ground. It is a decision made by our health experts. Title 42 is a health care law.
Right, and because, like Congresswoman Jayapal alluded to earlier, it was related to the COVID epidemic, obviously.
Correct.
If somehow that could be changed or adjusted, because obviously there's such an influx right now that there's got to be concerns about what is coming across the border.
And Congressman, again, it's a thoughtful question because there are challenges at the border. The difficulty is when you try to use a healthcare law to deal with immigration challenges. You have, either through the courts or at some point because of the science, it becomes clear that you cannot use a healthcare law, which is principally for the use of quarantining, to deal with a border issue challenge. That's why the president, his first day in office, submitted a immigration reform proposal to Congress to address a broken immigration system.
And Homeland Security is saying now, as of yesterday, they're expecting an additional 18,000 more migrants a day than are coming across right now. So, I mean, my issue, I think, would be how can we, first of all, let me just ask you, as a former member of Congress, as a secretary, and as a former AG in California,
yes.
Who's responsible for this, and how do we stop what's happening at the border right now? I mean, we have to get control of this situation.
I appreciate for the chance to answer. And I'm going a little out of my lane because I'm the secretary of HHS, but having worked here for 24 years on immigration reform, we have a system that's broken when it comes to asylum. When you can request asylum and you wait 4 or 5 years before your case is adjudicated, the difficulty is that a lot of folks in these other countries are getting the message, you can come through. You can't come through and stay because you have to qualify for asylum. The difficulty is it takes so long to process an individual that the message going back to some of these sender countries is, I can come through. That's not the case. And
well, with your experience, and tell me, how do you think we fix this issue right now? How do we secure the border?
If you read the president's proposal for immigration reform, it would tackle this. And it's not that difficult. What we have to do is protect due process, but we have to get these cases through because there will be individuals who will qualify for asylum. But there will be a lot of individuals who won't, and they have to then, through the process, be returned.
Okay, let me shift gears a little bit. So the average gas price in California is $5.82, probably the highest in the nation, maybe.
Hawaii, I think, may beat us.
Do you feel responsible for any of this, or do you see a linkage? Because when you were AG, you sued the Trump administration to stop them from opening over 1 million acres of land to oil and natural gas. I mean, do you see the linkage between the decisions that were made related to energy and what we're seeing right now? I believe the administration is kind of pushing it all on, you know, what's going on in Ukraine.
Yeah.
But I mean, right out of the gate, when President Biden was sworn in as president, the first thing he did was make some very high-profile decisions related to the energy situation. And I believe that there's linkage there. Do you believe that there is to the gas prices and the energy prices we're seeing right now?
Let me put it this way. First, I don't think anyone challenges or contests the fact that the Putin war, illegal war, has led to higher energy costs for everyone. But aside from that, what I did as AG was try to get our state to move as aggressively as it could to move away from foreign oil for these very reasons. When you're dependent on foreign oil, this is what happens. If we were not dependent on foreign oil, if we had our own clean sources of energy, we wouldn't have to worry about what the price of oil would be as a result of Putin's war. And so I think the faster we move in the direction that California wants to move, which is to move us away from these fossil fuels, the less we're going to be sort of dependent on what dictators like Putin do throughout the world.
Well, and that's an ideology, and we could talk about, you know, those bigger issues, I guess. But for right now, I mean, we find ourselves in a situation where the average American cannot afford to fill up their tank at the pump. And that's why either we got to back away from that or figure out a new strategy.
Gentleman's time has expired. Gentleman from Michigan, Mr. Levin.
Well, thanks so much, Chairman Scott, for convening this hearing. And Secretary Basara, thanks so much for coming to talk to us at least part of the time about the priorities of the Department of Health and Human Services. Secretary Basara, I want to talk about the essential ACA reforms in the American Rescue Plan. I was super proud to vote for the ARP, and it provided a 2-year enhancement of advanced premium tax credits under the ACA. This allows low-income folks to access low-premium plans. And because of this key provision, more people are enrolling in the exchanges. The recent enrollment period saw 14.5 million people sign up either at the federal level or through state-based marketplaces. Now, as you know, I believe healthcare is a fundamental human right. We ought to have universal healthcare in this country. But I want to really get down to details with you. How did the enhanced tax credits that Congress provided in the American Rescue Plan contribute to the ACA's historic coverage gains last year. What did we learn from the steps taken in the rescue plan, and how do we build on the successes of the ACA provision within the rescue plan?
Congressman, I know sometimes people don't believe me when I tell them this, but there were people who were looking at their potential choices on the marketplace for a health insurance plan who were finding, if they were eligible, 4 out of 5 of them were finding a health insurance policy where they were paying $10 or less a month for a policy for health insurance coverage. As I tell folks, go to a movie cinema and see if you can go see one movie for one night for less than $10 a month. Now you're talking about providing someone with healthcare coverage, quality healthcare coverage, robust coverage for less than $10 for an entire month. You can't do that. Those premium supports made it possible for us to decrease the cost of a premium by some 23%. You can't beat it. Thank you very much for what you did through the American Rescue Plan to make it affordable for Americans. And as you pointed out, the result, 14.5 million people, a record number, applied for health insurance coverage through the Affordable Care Act.
So another area that was really important was for HHS was trying to make progress addressing the public health challenges caused by COVID-19. And over the past year, the department's invested $250 million in US-based manufacturing of PPE and $950 million in manufacturing the supplies and equipment needed for vaccines, therapeutics, and diagnostic tests. And I think HHS has supported 90,000 vaccination sites nationwide, distributed over 500 million free at-home COVID-19 tests, shipped hundreds of millions of N95 masks to pharmacies and community health clinics. And, the COVID-19 relief funding that we've provided has been crucial to these efforts. But now you face a challenge. And so to continue your efforts to confront the future public health challenges we'll face with COVID-19 and beyond, how important is it for us to secure additional COVID-19 relief funding to restore and preserve life-saving prevention services? And I want to throw in there, how are we going to, vaccinate the world unless we get money in there for, for the global aspect of this?
Congressman, probably the analogy that comes to mind most is 2 minutes to go. We're down less than a touchdown. We're driving. We're going all the way to the goal line. We still have our timeouts left. And then all of a sudden, we're on the 1-yard line ready to score for America on COVID, beating back COVID. And we let the clock run while we could easily use our 3 timeouts. And right now, we have told Congress very clearly, and the American public, that the money that was made available for us to fund this fight against COVID has been depleted. We're not going to be able to do the same purchase for therapeutic medicines. We're not going to be able to do the same thing when it comes to the tests, making them available, including going to the test-to-treat model where you test, and if you find out that you're COVID positive, you can get treated right away, right there and then. You can't do all those things. It's wasting 3 timeouts to go plunge into the goal, across the goal line and score the touchdown for the American people. We can't do that. I hope you and members of Congress will find fit to provide us with the resources we need to finish the job on COVID.
All right, thanks, Mr. Chairman. I think my time's expired, so I'll yield back.
Thank you. Gentleman from North Carolina, Mr. Cawthorn.
Thank you, Mr. Chairman. Secretary, thank you very much for taking time to come speak to our committee. Mr. Secretary, do you have input and influence on health policy within the Department of Education?
I'm sorry, say that again, please.
Yes, sir. I was asking, do you have input on the health policy within the Department of Education?
To the degree that we consult with the Department of Education on some of their proposals, we would have that input, but if it's not within our jurisdiction, then we do it on a consultative basis.
Understood. As the Secretary of HHS, I'm curious to understand how this administration answers some of the following questions I have, as I believe they will directly impact crafting of education policy across the nation. Secretary, is it correct to say that the Secretary of Health and Human Services, your role is to protect the life and well-being of human citizens within the United States?
I am certainly responsible to make sure the health and well-being of the American public is taken care of.
Understood, sir. And can I ask you this? How do you define a human life?
How do I what?
Define a human life?
If you were out there making things happen, if you're surviving the tough challenges before us, if you're making it through and you have a loving family that's helping you out, all those things make it possible for Americans to move forward in a way that lets them prosper and become leaders for our country.
Right, yes, sir. But
Congressman, if I can ask you to speak up because it's hard to make out what you're saying.
Yes, sir. I'm curious, as you're the Secretary of Health and Human Services, we really care about when you start protecting the life of American citizens. The following conception in the womb, how long after that would HHS wait before they're taking action to protect that life?
Well, I will tell you that I'm not a physician. My wife is an OBGYN, and she could probably speak more directly to some of those more medical, technical issues. What I will tell you is that based on policy and how I can act as a Secretary of Health and Human Services, I'm guided by the law and what it tells us we can do when it comes to providing services to anyone at whatever stage you wish to consider.
Yes, sir. Well, I believe the lack of clarity in the answer of when a human life begins in America, I believe it has consequences. When you testified in front of the Energy and Commerce meeting, you previously stated there is no medical term such as partial birth abortion. There is not a definition of partial birth, but there is a definition of infanticide. Are you aware of the Live Action News article where they say that 5 viable babies, humans in America, were found dead and aborted here in Washington, D.C.?
Congressman, what I can tell you is that that term is a politician-created term. It is not a term that physicians use, not a term that my wife as an OBGYN uses to address the issues of pregnancy. But I understand where some of the folks who use that term are trying to go, but it is not a term that the professionals in medicine use.
Yes, sir, I understand that, but I mean, sir, Mr. Secretary, it was not 1, it was not 2, it was 5 human viable babies that were left dead in D.C. a few weeks ago. Quoting the article, a neonatal specialist called these babies premature people, humans within America. Secretary, your ambivalence about the definition of human life is instructive, and I believe in America it's dangerous.
Congressman, I'm not ambivalent.
Yes, sir. Well, this lack of clarity is immoral and a monument to the erasure of truth in our time. Mr. Secretary, you've pressed for federal funding to combat pro-life legislation and promote abortion through, and granted their euphemisms, but things like family planning against the will of the people and their elected representatives. And now we have 5 fetuses beyond the threshold of viability on the doorstep of Washington, D.C., and you can't tell us what a human life is. Those 5 children found in D.C. were just that. They were children. They were babies, humans, not medical waste. The callousness with which this administration views life and the sanctity of it is astonishing. A nation that cannot protect the most precious, innocent, and vulnerable among us has a moral compass that is not only stained, sir, but it's dead. With that, Mr. Chairman, I yield back.
Thank you. The gentlelady from Minnesota, Ms. Omar.
Thank you, Chairman. Mr. Secretary, thank you so much for joining us today, for your testimony, and for coming out to my district this past February. I would like to ask you about drug prices, which is a topic of great concern for many of my constituents and much of the country. A recent AARP study found that 75 of the 100 brand name drugs that Medicare spends the most money on increased this year. And surprisingly, no top brand name drugs issued a price decrease. If nothing changes, costs to Medicare Part D beneficiaries who take an average of 4 to 5 prescriptions a month and have a median annual income of under $30,000 will increase. For many people, that increase would have a ruinous effect. As you know, Medicare currently has no authority to negotiate rebates for Part D drugs, and an average Medicare payments higher net prices for top-selling brand name drugs than other programs such as Medicaid. that has the ability to negotiate prices. Mr. Secretary, if Medicare could negotiate drug pricing, how would that impact that budget?
Congresswoman, can you repeat the question itself?
Yes, if Medicare could negotiate drug pricing, how would that impact the budget?
Overall, if we're able to negotiate for lower prices and Medicare therefore is reimbursing manufacturers of these drugs at a lower cost, then it is not only a savings for the American taxpayer, but it is a boon for the Medicare recipients who right now are having to pay part of that cost out of pocket. So it's a win-win for everyone if we're able to negotiate to get the best price for the product that we know is going to be essential for these patients.
Mm-hmm. And would there be a budgetary saving for the country as well?
Undoubtedly. Undoubtedly, the cost of healthcare in America is higher than it is for any other industrialized nation in the world. One of those reasons is because we pay way too much for drugs that in other parts of the world are sold for less than what we have to pay, even if that drug may have been manufactured here in the U.S.
Right. Thank you so much for pointing that out. Not only would our country save money, but the people of this country will also have savings if Medicare was able to negotiate Part D drugs. Mr. Secretary, according to recent reports, as an estimated 122 million Americans, or 37% of the population, live in areas with a mental health professional shortage. To fill this gap, the country needs approximately 6,400 additional mental health providers. And a lack of cultural competency only further exacerbates the already serious disparities we are seeing in mental health services. How does the department's new investment in Mental Health Transformation Fund expand access to available mental health providers for communities?
Congresswoman, as you know, the president has made a request for close to $5 billion in discretionary funding and close to $52 billion over 10 years in mandatory funding to transform our mental health system. It is a budget that has never been proposed by a president before to really tackle mental health. I hope you and your colleagues are successful in helping get this across the finish line, because it will let us do so many things: provide more services, help boost the salaries of those precious mental health workers who are on the front lines. It will let us make sure we're moving towards those practices and those therapies that we know are most effective. It will allow us to actually begin to treat mental health with the same parity that we treat general health.
I hope we are successful in passing it as well. How would it address the specific cultural and social needs of populations that are dealing with disparities right now?
The president's proposals, and something we would implement at HHS, include proposals where we would try to go where the need is greatest and where we have often been absent. And so we are going to do everything we can. As Congresswoman, I have said before, we've done it with the Affordable Care Act enrollment. We did it with vaccines. We're going to go to places where we've never seen our government try to push before, because we think everyone should be included.
Thank you so much, Chairman. I yield back.
Thank you. The gentlelady from California, Ms. Steele.
Thank you, Mr. Chairman, and thank you, Ranking Member Scott and Secretary Basara. It's really nice to see you. My constituents and many across America have been the importance of access to telemedicine during the pandemic. Innovation and flexibility in healthcare policies are a win for Americans. Americans had more access to telehealth services during the pandemic, and this expanded service was very popular. We then sadly witnessed the loss of telehealth services for those who have high deductible health plans coupled with health savings accounts on December 31st, 2021. Fortunately, the relief was reinstated on April 1st, 2022 through the end of the year. While this is a small victory, the coverage provided by the omnibus legislation is temporary. It won't cover the first quarter of 2022, leaving employers with the uncertainty about how to handle claims for that period. Again, it is important to note that 30 million Americans lost access to healthcare for 4 months, especially for virtual primary care and behavioral health services. From those who cannot afford to pay $7 at the gas pump and drive to their doctors, or are a single parent, cannot afford to leave their child at home, virtual care is an important tool in the tool shed that will lower cost and expand access to care. This is why we need permanency in telehealth. With this in mind, Secretary Basara, as you know, 50% of individuals with an HSA savings in a zip code where the median income is below $75,000, do you agree that families and individuals with high deductible health plan coupled with the health savings account should have access to first dollar coverage of telehealth services?
Congresswoman, I think we've seen the value of telehealth as a result of this pandemic. We are appreciative of the work done in Congress to pass the omnibus bill, which gave the 5-month extension on some of the authorities to have flexibility with telehealth. We hope you work hard to extend some of those authorities permanently. Meantime, we're going to continue to do the research that will give us the answers to how much telehealth we can absorb and do right, because we want to make sure we're accountable. Once you start to remove the actual presence of the patient and the provider, there are a lot of folks who are going to try to game the system, and we want to make sure that doesn't happen, because telehealth has become too precious a service for so many Americans who rely on it now. And so we are absolutely committed to working with you to extend permanently coverage of services, for example, where the patient's home is considered the originating site. That's something that is not permitted right now without the extensions of telehealth authorities that you've given us. We want to make sure that community health clinics, federally qualified health centers, and rural health clinics can continue to provide services at distant sites. There are so many things about telehealth that we've learned. There's still much we have to do. The more that we have the evidence and the data to help us make sure that we're all accountable and that no one is gaming the system and taking taxpayer dollars without really providing a service, the better off those patients will be. So we're very much looking forward to working with you on anything having to do with telehealth.
Thank you, Secretary, because that was my bill with Congresswoman Susie Lee. We worked together. We tried to make it permanently, but it just had the extension. So you know what? We are going to make this one permanent, and I'm very glad to hear from you that you agree that it has to be permanent. How is the department approaching and analyzing telehealth policies like these to extend beyond the current public health emergency and after emergency?
I think I heard the question. I know it deals with the public health emergency and the telehealth authorities. I'm going to venture a guess at what I think you asked, and we have the authority to expand access to healthcare services through telehealth, because during this public health emergency, we were able to do things to stretch the laws legally in ways that allowed America to take care of all of its people during this pandemic. But once the public health emergency expires, once I remove the declaration saying we're under the state of a public health emergency, those authorities, the liberalized authorities that I was able to extend to the American people, go away as well. And so the sooner that Congress moves forward to change the statutes on telehealth to give us that flexibility in the areas where we've seen tremendous success, the better off the American people will be.
Thank you, Secretary Basara, and I yield back.
Thank you. The gentleman from New York, Mr. Bowman.
Thank you, Mr. Chairman, and thank you, Secretary Basara, for joining us today. I want to start by commending you for your leadership at HHS overall at a time of historic challenge. I know you and your team have been working around the clock to fight the pandemic, expand affordable health care, and implement President Biden's transformative American Rescue Plan. As you are aware, between 150,000 and 200,000 children have lost a parent or caregiver due to COVID-19. And 65% of all youth experiencing COVID-19 orphanhood are children of color. This fiscal year 2023 budget request provides $18.75 million to support evidence-based behavioral health services and community violence prevention programs through the Resilience in Communities After Stress and Trauma grants. Secretary Basara, what other HHS efforts have increased access to culturally responsive, community-based mental health services for children and youth?
Congressman, thank you for your interest and all the work you've done in this area. I will tell you that we are able to allocate dollars where we see the need greatest, where the gaps are also biggest. The resources we have wouldn't cover all of the disparities we see, but it helps address some of them. But I will tell you one thing that has been tremendously helpful to us, and where I am committed to make sure we make further investments, and that is working with our community health centers, those federally qualified community health centers that serve so many of those people who are uninsured, who fall through the gaps. And for example, we found that some 20 million Americans receive their vaccinations through community health centers. More than 2/3 of them, people of color. And we know that through the community health centers, we can reach people who are often missed. So I intend to make sure that we continue to make a major investment in our community health centers. But with your help, whether it's through SAMHSA, whether it's through HRSA and our different agencies, we're going to try to drive money and resources and support where we've seen the absence of that support in the past.
Thank you so much, Mr. Secretary. As you know, community violence prevention is a public health issue, and this budget adds more than $230 million for Project Aware and recast grants to support the implementation of evidence-based violence prevention programs. How does this fit into the department's broader efforts to promote community violence intervention?
Congressman, I'm sure you'll agree that gun violence is a public health crisis, and therefore HHS must be part of that solution to get us beyond that violence and the trauma that occurs. We are proposing some $60 million within the CDC and the NIH for further firearm violence prevention research. We hope you'll support that. We have $250 million that would be within the CDC to support the Community Violence Intervention Initiative. We would work in collaboration with the Department of Justice to make sure that we can use evidence-based community violence intervention strategies at a local level. So it's not just that we're saying we know best in Washington, D.C. No, we're partnering up with some resources with folks on the ground locally who are trying to address domestic community violence right there in their communities.
Thank you, Mr. Secretary. I have one more question about quality child care. Neuroscience research has shown that 80% of the foundation of a child's brain development occurs in the first 1,000 phase of life, which means the first 3 years of a child's life is critical for a child's health, learning, and executive function, making access to high-quality, affordable child care for every child fundamental. Yet this is out of reach for so many. A report from the Center for American Progress revealed that nearly 60% of mothers with children under 3 are employed, yet the average cost of infant care is more than 20% of families' income. On top of being unaffordable for many families, the supply of child care is far below what is needed. For every licensed child care slot, there are 5 infants and toddlers who need it. This shortage is significantly worse than it was for 3 to 5-year-olds and has only worsened throughout the pandemic. How does the budget request prioritize addressing resources for all infants and toddlers in the first 1,000 days of life that support this positive development, their positive development?
And I know time has almost expired, so I'll be brief to say, through the American Rescue Plan, and thank you for the support of that bill, we were able to make a major investment in child care services, but it was still only a drop in the bucket of what we need to do. And it is incredible to believe that for some families who can't even find a way to save money for their children for college, they find that in order to get child care, they would essentially be paying college tuition starting when the child needs to go into child care. That's how expensive it is. And so we absolutely have to do something to help, as well as help make sure we have a professional workforce that is adequately paid.
Thank you. I yield back.
Gentleman's time has expired. Gentlelady from Louisiana, Ms. Ledlow.
Thank you, Mr. Chairman. And Secretary Basara, it's good to see you here again. And I first want to thank you for coming before our committee to discuss the fiscal year 2023 budget priorities of your department. One of the first things I would like to talk about with you is telehealth. And what we have seen throughout this pandemic are the benefits that telehealth has been able to provide so many patients. As the pandemic winds down and society begins to return to normal, many of the telehealth flexibilities that were put in place as part of the public health emergency are still being utilized in positive ways. As you know and mentioned in your testimony, in the FY 2020 Omnibus, many Medicare telehealth flexibilities were extended for several months after the end of the public health emergency. I've heard from patients and providers alike about how much the flexible telehealth provisions have helped them. My district is very rural. If some patients are able to conduct telehealth visits when it is applicable, it can save them time and, with gas prices these days, a lot of money too. If there is one good thing that has come from the pandemic, the expansion of telehealth has made healthcare much more accessible to many patients. And I'm concerned about that accessibility if these telehealth flexibilities are not permanently extended. So my question is, as we wind down this public health emergency and Congress begins to consider the permanency of telehealth flexibilities, what do you see as the best way to preserve and even potentially expand telehealth availability to patients moving forward?
Congresswoman, thank you for the question. And everywhere I've gone in communities that are far more rural than urban areas, you can see the value of telehealth. We will work with you to try to make sure that we extend permanently some of the provisions that we've been able to employ during this public health emergency. So, for example, letting a person's home, a patient's home, be considered the site of the care makes it possible for us to extend reimbursement to those providers for providing care to those individuals. That expires, that ability to do that expires once the public health emergency is pulled down. And so we look forward to working with you to make sure that we've learned from the lessons of COVID, what works and doesn't work, and we move it forward. And I simply have to add, because we know someone's going to try to game the system, that we ask you for your help to make sure that the accountability measures, to make sure that there's program integrity to telehealth are there so that we don't let the bad apples ruin it for everyone who needs telehealth.
Thank you. Next, I would like to talk to you about an issue I discussed last year. When this committee discussed your department's FY 2022 budget request, I made clear how concerned I was that the department decided to forego 40 years of bipartisan precedent and remove the Hyde Amendment from your budget request. You responded to me that ultimately it's Congress's decision what will be included in the final bill when it comes to the issues of the Hyde Amendment. My Republican colleagues and I made it clear that any appropriations legislation that does not include Hyde Amendment protections will not gain our support. And the Hyde Amendment has been renewed every year on a bipartisan basis. Just last month, on March 9th, it passed the House of Representatives again with a Democratic majority and was signed into law by President Biden in the Appropriations Omnibus for the fiscal year 2022. That is why when the President's budget request for fiscal year 2023 was released last week, I was disappointed to see that the Hyde Amendment and several other longstanding pro-life provisions were again weakened or removed. Since 1976, the Hyde Amendment has saved over 2.4 million lives. This policy also reflects the views of nearly 60% of Americans who agree that taxpayer dollars should not be used to fund abortions. My question to you is, as the majority of the American people continue to oppose their tax dollars funding abortion procedures, and Congress has made clear that the Hyde Amendment protections are remaining intact, why does the administration continue to try and repeal this 40-year-old bipartisan provision and force Americans' tax dollars to fund abortions?
Congresswoman, thank you for the question. Having served 24 years in this body, I can tell you I'm very familiar with this issue. At the end of the day, you all will decide what our budget looks like. This proposal put forward by the President is his effort to try to let you and the American public know where he'd like to go. I am a firm believer that a woman is the best judge of how to provide for herself and her health care, and making that decision along with her physician, not with politicians. And so when it comes to the issues of abortion, I know that there are deeply held beliefs. We may not always agree, but what we should do is agree that everyone should have access to the health care services they need. And at the end of the day, you all will decide what the President's budget looks like.
Again, thank you for your time, Secretary. Mr. Chairman, I yield back.
Thank you. The gentleman from New York, Mr. Esbiat.
Thank you, Mr. Chairman. Thank you, Secretary, for your patience and for your time with us today. Secretary, as you know, the fiscal year's HHS budget for 2023 proposes $127.3 billion in discretionary funding. My question is, Secretary, how will this budget, the budget's new proposals for expanded access to mental health care address the needs of our nation's most vulnerable, including those that have fallen victim to the opioid abuse crisis without a lifeline of healthcare services they so desperately need? So this increase of discretionary funding, how would it impact on the mental health care of those folks?
Congressman, as you know from looking at the president's proposed budget, it is a game changer when it comes to mental health in America. It is proposing that we actually begin to treat mental health the same way we treat physical health. The general health needs of the population should be no different, whether it's mental or otherwise. And so the president really puts his money where his mouth is on that one. And we hope that this Congress will support and pass the president's budget when it comes to mental health services, for drug use services as well, because these are game changers that let us really go after the nut of this, which is to try to provide not just the preventative services, but the support for treatment, the support for after treatment as you follow someone through to make sure they stay off of the addiction or stay healthy with their mental health challenges. But at the same time, we also included something else that's very important: harm reduction. When it comes to those who are on the verge of doing something to themselves, up to and including suicide, we want to be there to be supportive, to get them away from that direction. And so I hope that you and your colleagues will find it fit to take this country to where we've never gone before when it comes to treating mental health.
Thank you. My second question, Secretary, is that the president's budget also includes $7.6 billion for the Child Care and Development Block Grant, which is an increase of $1.4 billion above the fiscal year 2022 level. How will this increase be allocated to solve some of the inequities that exist regarding child care and child care providers, and allow them to have access to perhaps better paid and a living wage? I think it's important that childhood educators are paid a living wage and that they're competitive and be able to stay in the business of providing childcare for America's working families. How will this help that direction?
Congressman, the president's budget dedicates additional dollars to child care in ways that allow us to begin to confront the challenges faced in communities that don't often have access to affordable and quality child care. But I will be honest with you, we will need far more resources to help our states and those local providers get to the point where we can make child care more affordable, meaningfully more affordable. And that's why the provisions in the Build Back Better legislation were so important, because they really let us take it to the next level. And I hope that there is a chance that you will at least incorporate the child care provisions in a bill or in this budget, because families are hurting. It became clear with COVID how badly they were hurting and how difficult it was for them to find quality child care. Now that we're getting all back to work, it still is very difficult when you're paying essentially college tuition for your 2-year-old to get child care. You understand how difficult it can be. And so we are ready to work with you. We're working with states to try to make sure they expand into areas where there is a lack of good quality child care today, but we will need to provide additional help and resources to make that happen and to get the workforce to get paid the way they should.
Well, Secretary, I look forward to working with you in that area, particularly as it pertains to family-based daycare providers who are, I think, more and more an alternative for working families because they provide a smaller setting, post-COVID-19 smaller setting. They're culturally sensitive and linguistically competent, and often provide the services that families seek. So I look forward to working with you to make it easier for them and more competitive for them to have a living wage. Thank you so much. I yield back, Mr. Chairman.
Thank you. Next is the gentlelady from Tennessee, Ms. Hochberger.
Thank you, Mr. Chairman. And thank you, Secretary, for being here today to answer questions. I have been a pharmacist in East Tennessee for 35 years, and it's very personal for me that Congress acts soon to lower the cost of prescription drugs. And there's no doubt that we have to reform the ways pharma companies price prescription medications and sometimes manipulate the system. But equally important to me is the need to reform these practices and roles of pharmacy benefit managers. These PBMs have exploited a lack of transparency and created conflicts of interest that have significantly distorted competition, reduced choices for consumers, and ultimately increased the price and the cost of drugs. And I'm really pleased that CMS has recently proposed regulations to reform the so-called direct and indirect remuneration fees by PBMs in the Medicare Part D area. And my question is this: do you agree that any congressional actions to lower drug prices would be incomplete and lacking without meaningful reforms to the PBM industry, sir?
I certainly hope, Congresswoman, that you all succeed in reforming the PBM structure, because we find that too many Medicare beneficiaries are paying far more for their drugs out of pocket than they should. We need to increase price transparency in this process. And we also have to try to make sure that we're promoting market competition. And so all of these things are important. That's why on these DIR fees, it's so important that Congress, if you can, move forward. We have a proposal that is working its way through the rulemaking process. We hope it will have an impact to help lower those out-of-pocket costs for consumers. We're going to try to do what we can, but if Congress can step in and give us some statutory authority, that would be very helpful.
Well, we need a transparent, economical, and efficient way to achieve these goals. And, you know, there's public comment is open now with the FTC ruling that hopefully people will send in their comments. And I am very willing to work with them as far as looking at the way they do business, because in an transparent world, I mean, there's pharmacies closing at every, you know, when you look at 2,300 independent pharmacies that have closed within a year, there's a problem. And these pharmacists are integral, especially in rural areas, when it comes to services they provide to these entities and to these patients. It's very critical.
I agree.
And I mean, it's, you know, there's so much intransparency, and hopefully the FTC will make the ruling that they will do an investigation into these problem areas. But I just wanted to make sure that that's on your radar. It's very important to me and a lot of my colleagues. So that's just one area that I think we can lower the price of prescription drugs for these patients. And I appreciate you telling me that you're going to be looking at that.
It's a flashing red light on our radar screen.
Well, absolutely. You ask for my help anytime, and I'm willing to do that, sir. And with that, Chairman, I'll yield back.
Thank you. Next is the gentlelady from New Jersey, Ms. Sherrill.
Thank you, Mr. Chairman, and thank you, Secretary Basara, for testifying before us today and for all of your time. One of the lasting impacts of the pandemic is its contribution to our nation's growing mental health crisis. And unfortunately, mental and behavioral health challenges have hit our children especially hard. As a mother of 4 school-age children, I've had a front row seat to the challenges our kids have endured over the past 2 years. These include remote learning, isolation from peers, and limited access to care, just to name a few. So it's no surprise that the number of individuals reporting symptoms of depression or anxiety has increased from 11% before the pandemic to 41% in 2021. Regrettably, individuals seeking affordable mental health services are facing significant barriers that, for far too long, have kept quality mental health care out of reach for far too many people. Even before the pandemic, less than half of individuals with mental illness receive services and treatment. Time and again, I hear from mental health professionals, parents who feel helpless, and children who just need access to care about the challenges of mental health provider shortage and limited access. It's why I fought so hard to secure funding in the FY 2022 Omnibus Appropriations Bill for the Mental Health Association of Essex and Morris's Suicide Prevention Services in Schools. So Secretary Basara, can you please outline what provisions in this budget will specifically address the complex mental health challenges our children are facing, and how this funding will specifically support kids in my district in North Jersey?
Absolutely, Congresswoman, and thank you for the work that you've been doing on this issue. As you know, the President in the State of the Union was very clear. He's taking us in a totally different direction. He's upping everyone's game. It is a game changer to see the kind of money that the President wants to put in his budget. The close to $5 billion in discretionary funding for mental health services, the close to $52 billion in mandatory spending that would come over the course of the next 10 years, that could help transform our mental health care system. And so I hope you have success in getting that across the finish line, because not only will it help us in dealing with this crisis that we see in America, but in your particular district, your providers, your advocacy organizations that are helping people on the ground would have the help that they need to make it happen. So we're looking forward to working with you on that, and I hope that you'll help us make sure that in your home state of New Jersey, that you all are ready to implement the 988 hotline to help those who are in mental stress. If they call, that they actually get a voice that answers that call and provides them with a service.
Thank you. I think that's so important. And something else that's really hitting our families hard has been childcare. So again, as a working mother of 4 children, I can tell you that even before the pandemic, the rising cost of childcare and the long waiting lists were not working for New Jersey parents. Now we're facing an even deeper crisis, one of the worst in the nation. Access to affordable, high-quality childcare is crucial to solving our worker shortage and fully reopening our economy. We know that over 4.3 million women dropped out of the workforce at the height of the pandemic, and more than 800,000 still haven't returned. Many of them due to childcare and school closures and problems with accessing affordable care. So these challenges continue to significantly affect our economy. Women are still missing 1.1 million jobs compared to pre-pandemic, while men are missing just 470,000. We need to change the status quo and make long-term investments in America's child care. Addressing the child care crisis will improve New Jersey families' immediate well-being and economic security while increasing statewide economic growth. Last year, Democrats passed the American Rescue Plan, which allocated critical, dedicated child care relief funding to states, and we've seen many states use relief money to stabilize the child care sector. Can you outline what else can be done to ensure states, including New Jersey, are able to continue supporting families, children, and educators in the long term?
Congressman, as you're aware, the President said that if we can get his Build Back Better proposal through, especially the proposal on child care, we can try to make sure that no parent, no family is having to pay more than 7% of their income for child care, which would be a tremendous lift for so many families, some of them paying up to 1/5 of all their income simply to provide child care. He is also talking about how we have to have a professional force. We have too many workers in the child care industry who are moving on because they could probably make more money flipping burgers than they could trying to care for your child or mine. And so we have to make it a professional service that's being provided. And so if we can elevate those people who do this work, and they are frontline workers in many respects, we do us a great deal of service. If we can help states who are trying to find ways, avenues to try to provide more access to these providers, to the services they need, so they can make it more affordable for you and me and all the parents in America, we all benefit. But the reality is, it's not free, and without some of the investments that the President has requested, especially in his Build Back Better proposal, it would be tough for us to be the true partners as a federal government in helping our state and local partners get to the net of this.
Well, thank you, and my time is expiring, but I sincerely appreciate it and have a great day, and I continue to look forward to working with you.
Thank you very much.
Thank you. The gentleman from New York, Mr. Jacobs.
Thank you. Mr. Secretary, thank you for being here.
Thank you.
In September of 2021, Mr. Secretary, records obtained by the National Institute of Health regarding a $1.5 million grant to the University of Pittsburgh to provide fetal tissue for research related to genitourinary tract issues, kidney, bladder, etc., raised concerns that the university may have violated the law by altering abortion procedures solely for the purpose of obtaining fetal tissue, and that aborted babies were born alive and killed by organ harvesting. I and my colleagues have written several letters concerning this matter. We remain concerned that the university may have violated the law and NIH regulations. If the tissue being used for this research was derived from aborted babies who were born alive and then killed by organ or tissue harvesting, would that be a violation of law?
Congressman, there are absolutely standards that have been set for the use of fetal tissue. There are laws in place to make sure we're protecting the practice of securing that fetal tissue. And I think all of us understand are very mindful of the importance of making sure that we do this the right way. Fetal tissue has been instrumental in helping so many Americans find life-saving treatment, and we have to make sure that we are respectful of the standards that are in place to make sure it can be done in the right way.
Thank you for that. So you do agree that the federal government has a duty to ensure taxpayer dollars are not used for illegal harvesting of fetal tissue?
We have to make sure that no taxpayer dollars are used in ways that are not appropriate under the law.
And you mentioned about research that is derived from this. Can you name a single clinical treatment that has utilized fetal tissue research in this development? Because I was not able to identify.
Coming from California, where we actually passed an initiative, statewide initiative, that provided monies to set up a center to do the research and help promote this within the private sector so we could harness the energies and the science. I am more than willing to provide you any number of studies, any number of examples of how fetal tissue has not only been life-saving, but has promoted the well-being of so many Americans who otherwise would not have any other method for their treatment.
Thank you, because we were not able to find a single development, even though it's been used for research since the 1920s, so I would appreciate that. I have another question regarding Medicaid spending. Medicaid spending is, in my mind, on an unsustainable path, ballooning more than 360% over the last 2 decades. The Trump administration had instituted some efforts to rein in this spending and put guardrails on it, but this administration has done the exact opposite. I am very concerned of its long-term sustainability. I'm also particularly concerned for my state. As you know, the federal government typically pays 50% and the states pay 50% of Medicaid obligations. New York State is unique in that it saddles local county governments with paying a portion of the county share. The county I reside in Erie County, 70%, over 70% of its county real estate taxes have to go to Medicaid spending, $215 million. This is an extreme burden, one reason our property taxes are so high and why we're losing people and businesses in our region. What are you doing in terms of making sure that Medicaid is sustainable? Because I do not believe it is on a sustainable path in terms of its exorbitant growth.
Congressman, thank you for the question, and I hope we can all agree that but for Medicaid and the ability to provide services to so many Americans during this pandemic, that we would have lost far more lives than we have. We know that today Medicaid is providing services to more Americans, some 80 million plus Americans, that has kept them in the game. And we know that once the public health emergency expires, that opportunity to stay healthy and to have access to care through Medicaid might expire for millions of those Americans. And so we're going to work really hard to make sure that not only is Medicare sustainable moving forward, but it is continuing to provide the care that's kept so many Americans alive and healthy. We'll look forward to working with you on that.
Thank you. I appreciate that because I understand what you're saying. I just do not believe it is sustainable, and there's not been an answer provided in that. Thank you. I yield back.
Thank you. Does anyone else seek recognition? If not, I'll recognize myself for 5 minutes. Thank you, Mr. Secretary, for being with us today. There are a couple of quick cleanup points. On the car seats in a car, the parent doesn't have a choice as to have a car seat. Doesn't the law require a car seat?
Car seats are required under the law.
Okay, and vaccines are required by law. You have to get a series of vaccines to go to public school. Is that right?
Correct, and
Okay,
seatbelts are required by law.
and we talked about opening the schools. Everybody wanted the schools open. The question is whether we're going to open them safely. A report came out just before the pandemic started showing that 40% of the school districts in this country needed to repair or replace the ventilation systems in their schools, in half their schools. Does it make a lot of sense to open a school in the middle of an airborne pandemic when you have ventilation problems?
Clearly, we know what can cause, what can lead to contraction of COVID, and we want to make sure we're keeping everyone, including our children, safe and healthy.
At this point, I'll suspend and recognize the gentlelady from Illinois, Ms. Miller, for her questions. Note the time. Gentlelady from Illinois is recognized for 5 minutes.
Thank you. Mr. Secretary, you're President Biden's Health and Human Services Secretary. My first question is very simple. What is a woman? Can you define the word?
Congresswoman, I'm looking at you, and I think you're a woman.
Thank you.
How much more do you want me to give you?
Well, if you're in charge of Health and Human Services, we want a specific definition of what a woman is.
Do you want a legal definition? Do you want me to give you what a definition I've grown up knowing all my life? If you could be specific, I could give you more, but I see before me a woman asking me questions.
Well, biologically and genetically, do you agree that women have XX chromosomes and men have XY chromosomes?
As far as the science tells us, I know of no science that would contradict that to date.
Mr. Secretary, can men get pregnant?
You're asking me something that I know of no evidence to the contrary.
As the mother of 7 children, I can assure you that only women can get pregnant. The American people will not take medical advice from someone that thinks that a man could get pregnant. Mr. Secretary, the Biden administration released shocking guidance titled Gender Affirming Care in Young People, which encourages children to take dangerous chemicals and have sex change operations that permanently end their ability to ever have children. Mr. Secretary, is it child abuse to perform a sex change operation on a 12-year-old child or younger?
Congresswoman, why do you wish to interfere in what that 12-year-old child and that child's parents would like?
Because the American people want to know what the Biden administration has planned for their children. These are permanently altering drugs and surgery that will permanently end the child's ability to ever have children. So we want to know, please answer me yes or no, is it child abuse to perform a sex change operation on a 12-year-old girl? Yes or no?
I'm not going down that rat hole with you.
The American people want to know, should doctors be allowed to perform sex change operations on children without their parents' consent?
I think most Americans want to have politicians stay out of the decisions that they and their doctor make.
So are you saying that there will never be a situation where a sex change operation or chemical castration will be done on a child without the parent's consent?
Congresswoman, a decision made by an individual with the consent, if necessary, by parents with the advice of their physician is usually going to be the best decision that could be made. Why you or any politician wants to get in the way of that, it makes no sense.
Will the Biden administration ever allow chemical or surgical castration of a child or being given puberty blockers without parental consent? Yes or no?
Congresswoman, you're asking questions that make no sense.
No, these are sensical. The American people want to know what the Biden administration has planned for their children.
This administration is
Are you going to cut parents out of these decisions? These are life-altering decisions. Once you chemically or physically castrate a child, they will not be able to have children.
I appreciate your particular opinions on this. This administration is not going to interfere with decisions that are made.
These are not my opinions. My constituents and the American people want to know what the Biden administration has planned for their children.
Congressman,
and your
how do you know what
guidance says that puberty blockers are reversible. Please explain to the committee how this process is reversed. How do you reverse chemical and surgical castration, sir?
Congresswoman, if an American wishes to receive services and is entitled to those services, and after consulting
These are
with a
children. These are children.
Most children, when they are in consultation with their parents and with a physician making decisions, these are decisions that don't need to have politicians interfere in them.
So you're saying that the Biden administration's policy is that you will never cut out the parents' consent before they are given puberty blockers or sex change operations?
This administration and I as secretary will make sure we are abiding by the law and enforcing the law, and letting politicians get interfere with the decisions, medical decisions being made by an individual and family and a consultation with their physician is not to me something
Mr. Secretary, do you believe taxpayers should pay for chemical castration and sex change operations? I know that the HHS website has listed new procedures that will be covered by Medicare and Medicaid, including facial bone remodeling for facial feminization, breast chest construction, and laser hair removal. Yes or no, Mr. Secretary, should taxpayers pay for this?
Carson, I appreciate your fervor in this.
Yes or no, should they pay for it?
I will
The
tell you
Biden administration, are they planning to have taxpayers pay for breast, chest reconstruction, laser hair removal, facial feminization?
we will continue to comply with the law and provide people with the protections they need to get the medical services they're entitled to.
Thank you, sir.
Thank you.
Thank you. And I'll resume. I think I had about 3.5 minutes left. Thank you, Mr. Secretary. I was talking about reopening schools. Everybody wanted schools reopened. The ventilation problems, you can't open a school in the middle of an airborne pandemic with ventilation problems. If you're going to open during a pandemic, you need nurses, counselors, extra buses to avoid overcrowding, PPE, things that cost money. It's my understanding that the American Rescue Plan provided more money for K through 12 education than any bill in the history of the United States. Is that right?
That's correct, Congressman.
So that those schools could open safely, not just open in the middle of a pandemic, but could open safely. We've heard a little bit about civil rights during the Trump administration, HHS's Office of Civil Rights gave non-discrimination waivers to taxpayer-funded child welfare agencies in South Carolina, Texas, and Michigan that allowed them to discriminate. In other words, the family would come forward and seek services, and they would say, no, we're not going to provide you those services because of your religion. Now, where I come from, that family would be the victim of discrimination. Incredibly, they're trying to redefine, under the Trump administration, they redefined the victim to be the agency. If they're not allowed to discriminate, then they are the victim of discrimination, and they were given waivers to discriminate. Did you withdraw those waivers so that the victims of discrimination would no longer be victims?
Congressman, you and I began service here in this body together in 1993. We sat on this committee together. We sat on the Judiciary Committee together. We both, for all that time, have worked to prevent discrimination, not to promote it. And I am still in the same vein. We're going to do everything we can to prevent discrimination.
And so you're not doing anything to prohibit faith-based organizations from participating. It's just that they have to follow the civil rights laws and treat everyone regardless of religion. Is that right?
Of course, as I said before, some of these religious organizations have been some of the best champions of getting families the care they need.
Now, Head Start is an HHS and not an education, primarily because you're providing more services than just education. What is the budget doing with Head Start, particularly early Head Start?
We are going to continue to try to increase the funding for Head Start, but certainly if we can get Build Back Better passed, we could do we could go the next level when it comes to Head Start, because we have so many families that don't have the opportunity to have their children attend Head Start.
And what can you comment on the services that are provided by Head Start and how you're doing on Head Start?
Well, as you know, Congressman, Head Start gives a lot of children in families that are more modest income families an opportunity to try to catch up to those families who are able to provide to their children educational services before they start kindergarten. Head Start is the one program begun decades ago that lets a lot of middle class, lower middle class families get to the point where their children are ready to start learning in kindergarten and beyond. And so we want to continue to beef up Head Start where we can. And if Build Back Better comes through, I think we take Head Start to a new level.
Thank you. I'll yield back the balance of my time. I want to thank Secretary for participating today. Members of the committee may have additional questions for you. We ask that you respond in writing. The record will be held open for 14 days in order to receive those responses. I remind my colleagues that pursuant to committee practices, witness questions for the hearing must be submitted to the majority staff or the committee clerk within 7 days. The question submitted must address the subject matter of the hearing. I now recognize the distinguished ranking member for a closing statement.
Thank you, Mr. Chairman. Mr. Secretary, it's clear from your testimony and answers, or lack of answers, to our questions that HHS and the Biden administration are not responsive to the needs of workers and families. Congressman Allen asked if regulatory action to fix the family glitch will cost taxpayer dollars. You responded that it will save taxpayer dollars. However, according to previous estimates from the Congressional Budget Office, this is untrue. Past scores indicate this action will cost taxpayers $45 billion to cover an additional 1 million people. I'm disappointed that the administration's reckless actions to increase spending, expand the federal government's role in health care, and increase access to abortion. HHS guidance has led to increased confusion for workers and students. The agency's positions on reopening, masking children, and vaccinations ignores the science, contrary to the many times you said today you follow the science. Further, the agency's attempts to force every American into government-run health care and institute price-setting schemes must stop. The administration is threatening access to life-saving cures and undermining the employer-sponsored insurance system that millions of Americans rely on and are pleased with. It's good, Mr. Secretary, that you came today in your capacity for this committee to conduct oversight. And I'm asking that you provide thorough answers to the written questions that will follow. Thank you, Mr. Chairman. I yield back.
Thank you. And I want to again thank the Secretary for being with us today. I want to particularly thank you for your work on the No Surprises Act. A lot of people will be avoiding big surprises and large bills, medical bills, as a direct result of the legislation that we worked together on and that you're in the process of implementing. I also want to thank you for solving the family glitch problem. That is a problem that had millions of people caught up in a situation where the worker had affordable coverage on the job, but unaffordable coverage for the rest of the family. They couldn't get help on the Affordable Care Act, and you have solved that so that if there's unaffordable coverage for the rest of the family, that they can get help. I want to thank you for all of your cooperation today and look forward to working with you in the future. And if there's no further business without objection, the committee stands adjourned.